Good afternoon, everyone, and a very warm welcome, and it is a very warm welcome today to the first virtual meeting of the Perth and Kinross Integration Joint Board. We're live streaming to the public, and we are scattered across various locations across Perth and Kinross and the wider country. And thank you to everybody for joining the meeting this afternoon. And I hope you all find it very interesting and informative and have the opportunity to ask whatever questions that you want to ask and receive answers insofar as is possible. We have a reasonably full agenda to get through, and so I want to make the discussions as focused as possible and the questions as focused as possible, and I would ask for your cooperation in that respect. So without further ado, let's get on with the business, and I would like to, in my welcoming remarks, first of all, pay tribute to the colleagues who have gone the extra mile, who have performed exceptionally throughout this most difficult period in any of our lives, and have made decisions which are affecting the lives of thousands and thousands of people. And we owe them an immense debt of gratitude. I would like to specifically thank Gordon Patterson for his leadership of the Health and Social Care Partnership, and all of his senior colleagues for their contributions throughout this difficult period, which is obviously ongoing. Even more so, I would like to thank the over 2,000 employees of the Council and other staff and NHS who are working on roles linked to the Health and Social Care Partnership. Their dedication will never be forgotten, and we are indebted to them all as a community. So thank you to one and all. Okay, as I say, without further ado, let's proceed with the meeting. And first of all, can I ask the clerk, Scott Hendry, to take our roll call to ensure that we have those that we require to have present. If, as Scott comes to your name, if you can unmute your microphone and say either yes or present, we'll get through this as quickly as possible. Thank you, Scott.
Thank you, Chair. Good afternoon, everyone. Can I just first of all confirm we've got apologies from Lynn Blair, Dr. Dougie Loudon and Bernie Campbell. So when I call out your name, if you could just confirm that you're present. Councillor Duff. I think Councillor Duff is maybe having some connection issues, so we'll come back. Councillor McDade.
Present.
Councillor Purvis.
Present.
Bob Benson.
Present.
Peter Drury.
Present.
Ronnie Erskine. Do we have Ronnie?
I think Ronnie was having some difficulties there as well, but we'll hopefully be phoning in very shortly.
Okay, Pat Kilpatrick. I think Pat was having some connection issues as well, so I'll move on. Gordon Patterson.
Present.
Jackie Pepper.
Present.
Jane Smith.
Present.
Sarah Dickey,
Present.
Maureen Summers,
Present.
Sandra Auld, Sandra.
Is with us, but not at screen just now, Scott.
Okay. Alan Drummond.
Yes, I'm here, Scott. Present.
Thanks, Alan. Stuart Hope. We don't have Stuart. Sandy Watts.
Present.
Thanks, Sandy. And we have a number of other officers in attendance from both the council and NHST side.
Okay, thank you for that, Scott. It's unfortunate that we currently do not have all voting members present. However, efforts are being made to get them joined into the meeting as quickly as possible. But I can confirm that we are currently quorate, and therefore we shall proceed with the meeting. So can I ask item 2 on the agenda whether there are any declarations of interest? In the absence of any comments, there are no declarations of interest. Thank you. And that being the case, we'll then move to the first substantive item of business, which is developing strategic objectives, and it in particular is the Chief Officer's report, incorporating in particular his report on the response to the COVID-19 pandemic. Gordon.
Thank you very much, Chair, and thank you also for your kind words of appreciation of the work that's been done over the last 3 months by colleagues in the Health and Social Care Partnership. It has to be said it has been greatly supported by wider statutory partners, and we would wish to also pay tribute then to the support we've had from NHS Tayside and from Perth and Kinross Council. I would personally like to add, if I may, my thanks and appreciation to the efforts of staff who have been tremendous in their commitment, their compassion, their professionalism during what has been the most challenging 3 months that perhaps any of us have worked through. So thank you for that. My intention in terms of the Chief Officer's report is to essentially prelude the substantive item that I have on the agenda, which is the update report in relation to our response to COVID-19. It's difficult, I think, in some respects to present a wider report, because that has been COVID-19, our response and preparedness has been the focus of our attention now for those 3 months. But I think it's important, given the stage we're at, where we're moving perhaps from a period of response into a period of recovery, to reflect on the programme of work that we had committed to the IJB that we would be undertaking this year. Work that has inevitably perhaps been put aside for the last 3 months as we concentrate our efforts in responding to the pandemic, and work that now we will have to begin to revisit. I think we need to recognise that whilst COVID-19 arrived suddenly, it will be slow to leave. It will be with us for some time, and it will shape the way that we live and work for several weeks, months, perhaps even years to come. So we need to consider what implications this has for the programme of work that we had planned. That doesn't merely mean that we'll have to review this in terms of the timelines, but looking through the lens of COVID-19, we'll have to consider whether our plans, ambitions and intended actions remain valid, remain relevant, desirable, and perhaps even affordable. So the validity of that which we set out to do when we delivered our plans and committed to the IJB at the beginning of this year, we now need to reflect and review on as we move into phase 2 of our mobilisation plan. So we're describing this as having been in a response stage. We're now moving to more of a recovery stage, and we're having to think and plan around the phase 3, which will be around renewal. Health and Social Care Partnership senior team, with managers across the partnership and with the partner agencies, need to review and calibrate those plans, and I would wish to commit to the IJB today that is our intention, that over the next coming weeks and into June and July we will review our plans. I want to illustrate the challenges around that with a couple of examples, and I'll try to keep this brief because I want to move on to the substantive report. For example, we had given a commitment to the IJB to review our community hospitals bed base. We have the experience of running these for some considerable time, and we had the modelling data. We have the modelling data that told us that we didn't have necessarily the right number of beds in the right areas. We were going to review that. However, thinking about our response to COVID, we now need to reconsider this. For example, taking into account, will more people need longer stays in community hospitals to rehabilitate and convalesce from COVID? Will we need to reconfigure our bed base to create more space between the beds in order to maintain social distancing? And what might the implications of that be for funding, for the level of finance, for the budget pressures? Significantly, in relation to all these examples, I think we also need to reflect that with test and protect, and perhaps large numbers of people self-isolating, this will have an impact on staffing too. Another example in relation to the plans and programmes that we were going to develop is around our complex care strategy. We were looking at how we could support people to move out of long stay hospital into more homely, less institutional accommodation that was more suitable to meet their needs in the local community so that they could enjoy better lives and better outcomes. In order to offer companionship, economies of scale, and to most effectively manage the arrangements that we had planned to put in place, we had some that included group living. We need to reflect on group living and whether that's effective and whether that can be achieved. And again, that's something that challenges our ambition when we look through the lens of COVID-19. Perhaps a final example is our commitment to deliver for you a community mental health strategy. You'll recall that we presented in December the plans around engagement, stakeholder involvement, and our ambition for that community mental health strategy. My inclusion of this as an example in this part of my report is not in any way to diminish the significance of that. It's actually to amplify how much more we now need to do in relation to community mental health. We need to think about how we can support people who will now be being affected by COVID, either because they're isolated, because they're distancing from others, because they're not connected, and perhaps because they're anxious about the effects of COVID, or perhaps they've been directly affected. So we need to think about how we expand, extend, and deliver an enhanced portfolio of services in the community that enable people to stay well, to stay connected. We also need to think about how we deliver our statutory functions and those services that we would have been delivering anyway, how we equip our staff with PPE, how we engage with people, how we embrace new technologies. So there are a number of challenges. We could apply these equally to the primary care improvement plan, our response to the joint inspection, and some of the other transformational activity that we have underway. People have stepped up, people have been adaptable, people have worked in different roles, and that has helped compensate for some of the deficits in our structure and in our capacity that we had known about and that the joint inspection reminded us of. So we were going to bring forward proposals around restructuring the Health and Social Care Partnership. As people move back into their new role, into their day jobs, and some of them are having to do that because these now have become a priority, This is potentially exposing to us still those gaps in our structure and our capacity around planning and performance, around commissioning, around care governance, around communication, HR and organisational development. These are areas that we also then need to consider in the coming weeks. So as we move from response to recovery, we need to review our previous programme of work through the COVID lens. We need to consider whether our plans, ambitions and intended actions remain valid. And we need to consider what will make a difference in supporting local people in Perth and Kinross with the challenges that they would have been dealing with anyway, but also now with the challenges of living with COVID-19. So before I introduce my more formal substantive report, that was my verbal update to the IJB, and it may well be the chair that you would wish to take any questions about that before I move on, and if not, I can quickly do so.
Thank you very much, Gordon. Before going to questions, I'm pleased to record that Councillor Duff, I think, is on the meeting, but maybe moving. We have Ronnie Erskine, who has been able to join us, and Pat Kilpatrick. Welcome, Ronnie and Pat. And we also have Stuart Hope, who has joined the meeting while Gordon has been speaking there. Is there anybody that we have missed that that has joined the meeting in the last few minutes? No, I'll take it. But welcome, ladies and gentlemen, and I'll now go to any questions in respect of that report. And first we have Bob Benson. Bob, you have a question.
Thank you very much indeed, Chair, and thank you, Gordon. And Gordon, could I just add to endorse what the Chair has already said? I also want to thank you for your work on Gold Command with Scottish Government across Tayside as well, which I know was an enormous commitment for you throughout this period of time. I won't ask specific questions about COVID at this stage, Eric, but what I would like to take is to pick up what you've both been saying about the work of staff. And what I would like to ask is, what practical measures can we take moving forward to recognise the contribution of health and social care partnership staff throughout the pandemic and to support their mental health and well-being moving forward? Thank you.
Thanks for the question. Gordon, are you able to respond?
Thank you, Bob, that's helpful, and thank you for your comments in tribute to staff. We have very quickly become very aware of the challenges of working with COVID, both in relation to what impact that is having on people's lives and a recognition that out with our work life, people will be having experiences related to COVID through themselves, their own health, their family members and people they know. We've also increasingly been recognising the new ways of working themselves take a toll, the remote working, the lack of connectedness, the fact that we're spending time with screens rather than with people. So throughout the last period, certainly after the first 2 or 3 weeks of working in this way, we have enlisted support from colleagues in the NHS and in the council to deliver support around health and well-being of staff and to recognise how we might support staff, signposting them to resources, providing them with support and advice. We've also built into our ways of working a recognition that we need to take breaks, that we need to think differently about how we work. And we're looking across both organisations with colleagues in HR around what are the implications of this for compressed hours, for flexible working, for new ways of supporting people to work in a different way because of the challenges of how we're having to operate at the moment. It's important to also recognise that we might have to think about how we can better achieve work-life balance, perhaps with some blurring in that regard. I'm thinking here about people who might be able to work in a different way around their childcare arrangements, they may also be looking after elderly parents or relatives who are shielding. So we need to recognise the holistic aspects of this in terms of the well-being and welfare of our staff, and we need to continue to look at how we can better improve that and be sensitive to how working in this way may well be impacting on them. The other thing I would say is that we have the involvement of staff side in our command structure, and the employee director from NHS is obviously in the gold structure. We need to hear the views of staff side. We need to be challenged if there's more we can be doing in that regard, because collectively that's a responsibility that we have to take very seriously.
Thank you, Gordon. Okay, Councillor Purvis.
Thank you, Chair, and thank you for your.
Just lost you there again, Callum.
Can you hear me?
Hear you now. Yep.
Okay, thank you, Chair, and thank you, Chief Officer, for your verbal update. I wanted to ask specifically on the Community Mental Health Services review, which you alluded to, and just to seek assurance that while acknowledging the points that you've made in relation to some of the mental health implications of the coronavirus pandemic, and in particular the lockdown, that will be progressed as soon as possible, because it goes right back to the original recommendation in the interim report, and I know we'll speak in more detail about the independent inquiry later on, but about the need to review community mental health services in advance of looking at reviewing of inpatient mental health services. Now, I know that this integration board took a different decision in that regard, but I think it is still very important that the community mental health services review for our part in Perth and Kinross is done as soon as possible. So just if you could provide that assurance.
Certainly. I hope you can hear me okay. My screen's buffering and I keep perhaps dropping out, so I'm having some technical difficulties, but I got what you said, and I don't underestimate the significance of that. I think it's probably worth reassuring and advising the IJB that we are in the midst of a period where we are less concerned about a strategic document being delivered in several weeks or months' time, and more concerned about how we can deliver effective responses throughout the period that plan is being developed. So, for example, we have already invested some additional resource into the third sector to provide mental health support in Perth and Kinross, recognising the challenges around COVID. And I think our mobilisation plan at the moment has a figure of £100,000 in relation to both alcohol and drug and mental health services. So there is a very strong ambition that we respond as we go, that we engage with the third sector, that we're responsive to people's needs, that we hear the views of stakeholders, and that we provide services as we develop the strategy. The strategy has been deferred in some respects because of COVID, but our commitment to working with people to address the impacts of poor mental health has not been diminished. So we're now talking about looking at how we can engage more virtually, remotely with people as we develop the strategy. The same pillars and ambitions are within the strategy, but my challenge back to Chris Lamont and colleagues who are part of that stakeholder group will be the need to look through the lens of COVID to see what that means for the here and now, as well as where we might be in a year's time. So this is a strategy that takes on even more significance and will be given greater priority in the coming weeks and months.
Thank you, Gordon. I have two more questions lined up. Maureen, I don't know if you have any question to ask, and I'll come to you after these two. Do you have anything?
Yes, I do. Yeah. Thank
Okay,
you.
I'll come to you after Councillor McDade and then Sandy Watts. Councillor McDade.
Thank you, Chair. Thank you, Chief Officer, for the update. I wanted to just probe a couple of things. I wanted to probe, Gordon, you were talking about staff obviously returning to their day jobs, as it were. So I'd be interested to know if you could give us a bit of a very rough analysis of how many or percentages of staff who were perhaps redeployed into other roles for COVID but are now able to return to their sort of more day job. And then the other point I wanted to raise was around the information we're submitting to the Scottish Government in terms of care homes. I think it was very positive in terms of at the start of the pandemic, we managed to reduce our delayed discharge numbers significantly, but I think there's a lot of concern around people perhaps who are discharged without COVID tests. So I'm just wondering if you can give us a bit more detail about the care home situation and the numbers we give the Scottish Government, and perhaps the IJB could be supplied with these numbers.
Yes, so certainly. If I could, Chair, defer the second question until I get my COVID report and we can talk about care homes in that context. The first question, I may ask Chris Jolly to see if he's got any figures that he can perhaps drop into the chat, and then we can respond with a bit more data around that, Councillor McDade. But that aside, we can get you that if that's something that's going to be helpful. I think the important thing, the crux of your question is how do we ensure that we can maintain our COVID response and we don't do anything to the detriment of the good work that we've delivered over the last 3 months as we start to ease into a more new normal. I think that's really challenging for us. I think we are having to, essentially what we did from the outset was we identified our priority services, we listed them all, we gave them a RAG rating, and we said at various stages, if the worst case scenario falls, these are the services that we will have to maintain no matter what. These are services that we can maybe deliver differently, and these are services that we may not need to deliver or we won't be able to deliver because of social distancing or whatever. So we've done that and we've worked to that, and we've really benefited from staff across the partnership working flexibly. And I'm talking here about dentists and podiatrists who've gone to work at the front line of COVID wards, who've supported us in different ways. We've got staff who worked in community hospitals. We've got staff who've moved into psychiatry of old age. But I would not at all wish to overlook the contribution of our support staff and our corporate services. They set up a command structure. They set up a workforce matching unit. They set up the infrastructure that has helped us to deliver on this. But we do have final accounts to sign off. We do have annual government statements to agree. We do have an annual performance report, and we do have activities that we had managed to defer that we now need to look at. We won't sacrifice our efforts to deliver effective frontline services for the sake of those, but we need to find a balance that enables us to do so. The other example I would cite for you is the challenges around potential staffing impact of contact tracing. So the model of test and protect might involve staff having to self-isolate. It might involve large numbers of key workers not being available to work for us. So we need to begin to think about modelling that. We need to think about what the implications of that are. And we need to have a degree of preparedness similar to that which we had in early March, so that we can respond quickly if there are staffing pressures in any of the essential services. So I think that's how I would seek to answer your question at the moment. I hope I've covered some of what you were looking for. Happy to expand on that if need be.
Yeah, okay, thanks, Gordon. And you indicated you'll revert to directly COVID-related matters in the next item on the agenda. But nevertheless, I understand Councillor McDade has a supplementary question.
Yeah, I'm happy to bring it up under the next item, but it was just to follow up on some of what the Chief Officer just mentioned in terms of staffing capacity, because this is really about staffing in terms of when the new test and protect provisions are in place. Are we, and you were talking about doing some modelling, in terms of that modelling, will that allow staff to potentially assume other duties at home if they're having to self-isolate for 2 weeks, even if it's not maybe their normal duties? Do we have the ability to do that?
Yes, we have had people who've been shielding. We've had people who've self-isolated and people who've been able to, whilst doing that, work remotely, if they've been well enough and if that's been appropriate. The other thing that I know that colleagues in the NHS are looking at, and principally in the first instance with the numbers of NHS staff who are shielded or self-isolating, is perhaps the potential to enlist them as contact tracers, which is a task that can be done on a desktop, remotely, using telephone and digitally. So yes, we will look at that. And I suppose the encouraging thing is that people have said, what do you want me to do? How can I help here? What is it that the partnership needs from me? How can I make a difference in terms of supporting people who are impacted upon this? People haven't been talking about their terms and conditions, but we've been having to remind people we've got a duty of care and they need not do too much. So there's a balance to be struck there. The other thing I would say is that we do have arrangements in place to reach into retasked staff from Perth and Kinross Council, thanks to their contribution to our joint endeavours, and also from NHS Tayside. So we are very much looking at this collectively and sharing our available resources. For example, the delivery of our community assessment hub at PRI was greatly aided by staff from the acute division because of the reduced capacity in the hospital. So we're working very flexibly across all systems.
Okay, thank you very much for that. We now have Sandy Watts with a question.
Thank you very much, Chair. Just a small point really. We had a meeting of the third sector forum this week, and it was very evident that members of the organisations in the third sector had all responded very rapidly to the demands of the pandemic and had quickly been able to put in place alternative working arrangements so that we could all continue to deliver our services. I accept that as smaller organisations, in many ways, it's easier for us to respond quickly in a situation like that. But members were disappointed that there seemed to have been no recognition of the hard work from third sector partners, alongside the thanks to the staff, which was very well deserved, the staff in the NHS and the council.
So I can only apologise for that, Sandy. My view is that the third sector have played a critical role. They have been linked much more closely perhaps with the council and their efforts around shielding, around volunteering, around community capacity building. I think the third sector have excelled. I think they've stepped in and they have shown creativity, initiative and resilience in difficult times. And I think they provide us with a very strong reminder of the importance of how we work together in future. And I really regret if we haven't acknowledged that either in correspondence or in person. The third sector, I think, are going to be key to our recovery activity. And I think the report on COVID highlights the potential for us to think about how we build on, capitalise on those good things that have come out of this dreadful situation, and that includes things around, community capital, the role of the third sector, supporting communities, volunteering, informal service responses that take the burden of pressure off statutory informal services. So let me reiterate that apology and state here a commitment that I'm very keen that we recognise and continue to work with the third sector, who have been really, really effective during this time.
And I too would like to closely associate myself with Gordon's comments there, and I believe Karen Reid, Chief Executive of Perth and Kinross Council, would like to come in now as well.
Thank you, Chair, and it's really to reiterate the points made by both yourself and the Chief Officer. Sandy, to perhaps give you assurance, I have actually issued 2 videos thanking members of the public, community groups, the third sector, our staff, etc. I've also issued 2 letters that have been printed in the local media to that effect as well. So if it's not clear to you on behalf of the partnership or indeed on behalf of the council, let me make it clear now. We are extremely grateful for all the help and support that we've received from the third sector and indeed community groups, volunteers and everyone who has really supported the partnership and the council through this pandemic. So thank you.
Thanks for that, Karen. And Jackie Pepper, you have a comment as well.
So, yes, thank you very much, Councillor Drysdale. It was really just to say, referring to Councillor McDade's comments about the additional pressures from Test and Protect. And from a social work perspective, as part of our response to COVID-19, we've kept the social work staffing capacity under continual review. There's a joint interest in that from the IJB and with the council. So in terms of mental health officer and adult support and protection as essential statutory services, we have not needed to implement any arrangements to supplement the staff, and we've maintained adequate staffing for that. Nevertheless, there was a plan to draw upon experienced staff who are working in other aspects of social work services across the local authority area should we need to bring further resource into those key areas, and that would still apply should we reach that situation in the future. I think it's also important to note that the Coronavirus Act of 2020 provides for some easement of certain statutory functions, including the assessment or formal assessment for community care services. And locally in Perth and Kinross, we have not had to implement that easement, so we're continuing to carry out assessments. But there is the potential to implement that should we need to in the future. So I think that gives you some reassurance of the current position in terms of social work staff.
Thank you, Jackie. That's these are very welcome comments, and thank you for these. Sorry, we have some audio interference there, but I think, sorry, I've omitted to come back to Maureen with her question. Maureen, do you have a final question, please?
Yes, yes. I am a bit concerned because of you know, something that's in a paper later on. It's page 30 of the paper, so I'll probably come to that later. But also because of an article in the Courier yesterday, and it was put there by Jane, you know, our finance officer, and you know, that was stating that.
Just on that, Maureen,
yeah.
Jane will respond to that in her report, which is coming up later on in the agenda. I can assure you.
Right.
That will come back.
Give me a prompt at the time then. Thanks. Okay. Yeah. Thank you.
Okay. Thank you. And meanwhile, just to record for those that aren't looking at the chat at the moment, you'll see that Chris Jolly has responded to Councillor McDade's question and will revert as soon as possible with data after the meeting. Okay, so if there are no further questions, thank you, Gordon, for that part of your report. And can I ask you, therefore, to move on to the substantive report on the pandemic response? Thank you.
Thank you very much, Councillor Drysdale. So I think what we've done in the last 5 minutes is sort of blurred the bit between COVID and the new normal, and that's really the challenge that we're now having to manage as a partnership as we transition. We can't just switch off everything to do with COVID. But we do want to ease back into the delivery of some services and the delivery of some obligations, applying that through the lens of COVID. I hope that members of the IJB have had the opportunity to read this report. It is, I know, fairly lengthy, and some of it perhaps is already captured into the IJB bulletins, but I thought it important to collate that together in a single report, particularly for the public record. The report outlines the key actions that we have advanced in response to COVID-19. Those are in bullet points at section 3. And I think, given the discussion that we've had today, I would perhaps prefer not to go through them in any detail, but to take questions, Councillor Drysdale, if that's okay. The next section of the report, though, obviously highlights the key challenges, some of the areas where we have had direct experience of COVID. And it has to be, we have to acknowledge that frontline staff have been working with people who are affected. They have become infected, they have become unwell. Thankfully, they have all recovered. Sadly, some of the people with whom we work with have succumbed to the pandemic. But those staff who are working in those environments, I think we need to acknowledge, and that's inpatient hospital, that's prison, that's social care, that's in care home settings. Can't underestimate the fact that this is impacting on people really quite significantly. So I've identified in section 4 some of the challenges that we've experienced, and then I've put a substantive section in around our work within care plans, within care homes. The conclusion of my report really segues into what I said earlier, and that's about how do we recognise all that has been good in this really, really bad situation? How do we capitalise moving forward and not revert back to some of the things that we had already agreed we needed to change? So when we think about digital working, we think about the opportunity to work remotely, we think about the commitment, the agility of our workforce, we think about, as I was saying to Sandy earlier, the community capacity, the way that people have stepped up, how that can be mobilised and supported. There's enormous potential for us to take some good out of this and to look at how that influences our future developments as a partnership. Final point before I open up or suggest that you might want to open up for questions, Chair, is around care homes. So care homes are receiving considerable focus, and rightly so, because there are people there who are experiencing a degree of vulnerability. People are older citizens, and if we don't do the right thing by our older citizens, I think a society is always should be judged by how the dignity, respect, compassion it shows to its older citizens, and how we support them is absolutely significant. We have been developing our approach. It's really unfortunate Lynn Blair from Scottish Care isn't here, because we have been commended by Donald McCaskill, the Chief Executive of Scottish Care, in Perth and Kinross, for the joint work that we've done with Lynn Blair, with care home providers from the outset, when we set up weekly Zoom calls, when we brought in consultants from public health to provide information, advice and assurance, when we brought in Dougie Loudon in order that he could explain how we would mitigate the risk of people who had an infection moving into care homes. At the same time, as it's fair to say, the Chief Executive of Scottish Care has been highly critical of some other aspects or other areas. So it's really unfortunate that Lynn's not able to be with us today, because it would have been probably really important to hear her views and her perspective as our integration lead from Scottish Care. So from the outset, we've worked very closely with care homes. We've followed the guidance when it's become available, and it has evolved through March and April and indeed into May. We've supported staff to access testing. We've supported residents to access testing. Before it was a requirement of the guidance, we were seeking to do so. NHS Tayside has been at the forefront of providing testing to key workers, to teachers, to prison officers, to police, as well as to health and social care staff. So we've sought to bring forward a number of measures to mitigate some of the challenges that care home providers have been experiencing, and that has had some positive effect in terms of limiting the numbers of outbreaks or the incidence of COVID. However, that doesn't in any way diminish the fact that, as we know, a number of care homes have been directly affected and impacted, and a number of residents have died, perhaps as a result of COVID, but certainly with a COVID diagnosis as well as perhaps underlying conditions. So we need to be very, very sensitive of that and recognise the impact that's having. I'm happy to answer any specific questions around care homes or more generally the rest of the report, but I think it's probably better that rather than I continue to speak about it, we move on to that part of the agenda.
Thank you. Yes, I would totally agree, and I'm keen to allow as much time as we can for questions. Can I just add to Gordon's report? I hope that members will have received in the last 24 hours the most up-to-date data available in respect of Perth and Kinross on some key statistics in terms of the level of infections and sadly deaths during the last 3 months, and that is provided by way of a detailed background with comparisons with comparative areas and authorities, just to let people see how things are doing in Perth and Kinross. So again, that's an effort to give you the most up-to-date and complete information that is reasonably possible to give you, and I hope you've found that useful. So I'm putting it open to questions now, and if you can signify in the meeting chat again if you have a question, which Bob Benson already has. So Bob, fire away.
Thank you very much, Gordon, and thank you very much for what I thought was a very positive report in very difficult circumstances. I've got a number of questions, but I'm going to start off with 2 of them in particular. In the note of your comments on adaptation and planning and future affordability, will the Integrated Joint Board have to review our strategic priorities and risk assessment in the light of the COVID-19 experience? And secondly, has the Health and Social Care Partnership relationship with the acute sector changed? Does the reduction in delayed discharges suggest ongoing investment in care at home, care in the community, and care homes brings relief to overstretched acute settings?
Thank you, Bob. So yes, in answer to your first question, I think we will have to certainly review our strategic risk register. We have updated aspects of it, and we need to build on that in response to COVID. That is going to be something that we will report back to the IGB and ensure that you're appraised of any changes in the risk profile. In terms of strategic priorities, I referenced those at the end of my report, and I think they stand the test of time. I think they're relevant. I think that the question is not whether they remain valid, but it's how we deliver on them in the new way of working. I think, we're reflecting on the best use of resources. We're talking about working in communities. We're talking about person-centred care, addressing health inequalities, early intervention and prevention. These are absolutely valid and will continue to be our watchword moving forward. How we achieve that, we will have to look at and review, as I've indicated. In terms of your your second question, we have always enjoyed very good and effective relationships with our statutory partners, be they in the NHS or in the council. We have been able to mobilise around this single issue to work effectively to support the discharge of patients from hospital. It is always our ambition to support people to move out of hospital when they are clinically fit to move, because we know that otherwise they potentially become demotivated, they might be exposed to hospital-acquired infection, and it's really not the right place for them to be. By not being in the right place, other people can't get to the right place. So people who need hospital care and treatment, particularly electives, may well lose out because patients are in hospital who don't need to be there. We need to learn from what has worked well. Some of that is about us putting additional resource into the hospital discharge team. Some of that is about deprioritising other activities and moving people into work in and around delayed discharge. Some of it's about 7-day working. Some of it is about how we are involved and engaged in daily huddles with acute colleagues. And we are looking at how we can take a whole system response to what is a significant challenge. And what we need to do is not be complacent about that which we have achieved, because while the impact of COVID on acute hospital has not perhaps been as significant as had been feared, and the acute hospital system is looking at gearing up, remobilising, what can it bring on stream. The community capacity perhaps isn't there because we moved a number of people from hospital and because community services are continuing to be impacted on by COVID quite significantly. I'm thinking here about care at home services, but particularly care homes. So if we began to take back to 100% productivity in the acute hospital, we would quickly have a delayed discharge problem because we won't have that flow until we've got that community infrastructure. It won't surprise you to hear me say that I would always think that what we should be doing is investing significantly in the prevention of admission, reducing the length of stay, and getting people home as quickly as possible. And that is about the primary and community social care and healthcare services that support people effectively in their own homes.
Thank you, Eric. If I may supplement that with 2 further questions, and I'm happy for Gordon to be brief on them, if that's okay.
Yeah, if we could, I am watching the clock ticking
by others as well.
Yep.
Gordon, how will we adapt to the likely impact of lower staff productivity due to new health and safety procedures for staff in the Health and Social Care Partnership and primary care, with the added postponement of outpatient appointments and elective surgery? It's a very difficult period. And then finally, I think an upbeat one, how can we best capitalise on the learning from the successful Community Assessment Hub, new operating models for GP practices and use of digital technology? Thank you.
Okay, thank you, Bob. So the question around lower staff productivity. I suppose the challenge, I'm having to tell people to stop working. I'm having to tell people to take a break, to look after themselves. We're having to tell people to say, you know, look after yourself, because you're going to burn yourself out and you're going to not be able to function, and we care about your welfare. So, I mean, I think productivity will be impacted on if, for example, we have to reduce the number of beds in a community hospital because of distancing. I think there will have to be nationally a recalibration of the priorities and targets that the health service have to meet in view of the need to look through the lens of COVID. You know, it may well have an impact on some of the challenges around the delivery of some services. But what we've also got are new ways of working and agility across the workforce, a more integrated approach. And the learning, as you described, that we have had from the past 12 weeks, which has, as my report sought to indicate, demonstrated some positives that we do need to build on. How we do so, I think I would need time to reflect on that. I think that's a really good question, because the difficulty that many of my colleagues have is a difficulty that you'll recognise. We don't create thinking time. We don't create the opportunities to reflect. We are firefighting too often. We're on a very, very busy schedule, and we need to, and we start to do things intuitively. We start to do things because they're the right thing to do. What we need to do is demonstrate, is to better evidence the measures of effectiveness, the measures of success, the enablers, the things that have made things happen. And some of that will also probably help in relation to your question about productivity. If we can remove some of the barriers that have otherwise perhaps hindered people to work in an integrated, flexible way, always driven by a desire to improve outcomes, and we strip back some of what we sometimes create as bureaucracy, that becomes easier and more rewarding, and more rewarded staff are more productive staff.
Thanks very much indeed.
Thanks for that, and I think Karen Reid would like to come in here with a comment.
Thank you, Chair. If I can just respond to the latter point that Bob made. One of the things that Perth and Kinross Council, as I'm sure many organisations are doing at the moment, is thinking about recovery and renewal planning, and as such asking through impact assessments what has worked well across our communities, what needs to change, etc. And that will give us a really good evidence base on which to inform the question that you've just asked the Chief Officer around what are the things that have worked, have been successful, that we would like to retain, and we'll have the community citizen evidence to support that. So thank you.
Thanks for that, Karen. Thank you. Now, I understand now that Pat Kilpatrick, you are on phone rather than online, and if you have any questions, if you can just let me know, just jump in, and just say hello, then I can take your question. And the same goes for Maureen, who's in the same position. Do either of you have any questions before I go to the final two questions from Councillor Purvis and Ronnie Erskine?
Yes, I have, Eric.
Okay, Maureen, go for it.
Right. On page 8 of the report, the first bullet point says in March, the T ward at PRI had a small group of patients, and that was actually emptied out for to get ready for COVID overspill. You know, it's now operational again, and it's my mother-in-law is actually in there at the moment. She's been in there since last week, so T ward is back for rehabilitation of old people. So just to note that. And then the next bullet point, in early April, 2 wards at Murray Royal Hospital were identified as having patients with COVID positive. Now, I know for a fact, because I know personally of 2 people that have died up there of COVID. And I just wondered, has that been included in the chart that you have of the local deaths in the area here for care homes? Are the deaths at Murray Royal psychiatry of old age, where are they recorded?
So they're recorded in hospital deaths, Maureen, rather than care homes?
Right, so it's included with hospital deaths at Murray Royal and Nine Wells then? Sorry, at PRI and Nine Wells. It's just any hospital in Teesside, right? I just wondered about that because, you know, as I say, I know personally of 2 people that have died up there of COVID. You know. Okay,
thank you for that, Maureen. And I'm sorry that you're any bereavement that you've experienced or people that you know that have died as a result of this. Okay, Councillor Purvis.
Thank you, Chair. A couple of questions for the Chief Officer on testing. I know that this was raised by a number of councillors at the full council meeting that was held, I think, last week. I know that Councillor Bailey asked about the number of people who've been discharged without a test before the main testing regime came in, and Councillor Stewart asked a separate question about the time taken between the 2 tests that were required. It was just in the answer to that second question, the Chief Officer, you referred to the guidance that the Health Protection Scotland, Public Health Scotland and NHS National Services Scotland had issued. And it says that where testing is not possible, for example, where the patient didn't consent to testing or where it would cause distress, that people could still be discharged into a care home if they were clinically fit, as long as they isolated for 14 days. Now, notwithstanding the assessment that needs to be undertaken to ensure that they're clinically fit, obviously there is the potential that people could develop symptoms later on, and presumably we would think that a hospital setting has higher infection control measures than a care home setting, presumably even despite their best efforts. So I suppose the question is, do we know of any people who have fallen into that category? In other words, are still being discharged without a test following the introduction of the regular testing regime? And if that has been the case, have any of those people developed COVID symptoms during that 14-day period of isolation?
So, I mean, I would wish to reiterate that the colleagues in NHS Tayside, for it was mostly a question for them in terms of the delivery of the testing regime, have both complied with the relevant guidance at the points when it has been issued and revised in terms of testing, and indeed had introduced testing opportunities ahead of that in those circumstances when it was felt necessary and able to be delivered. People who have been discharged from hospital and have not been tested would be required, if they were moving into a care home, would be required to self-isolate or be isolated by that care home, provided, you know, with care and support by staff, donning PPE for the 14-day period recommended. If they became ill during that period, I would be unable to tell you from where that infection came. We haven't done a detailed analysis or tracked those patients. We have the other part of the question, I suppose, which I would wish to reiterate, is that if people are symptomatic, they wouldn't be deemed clinically fit for discharge, so they would be not discharged to a care home with symptoms. That provision within the guidance is really for people from whom a test cannot be taken because they won't comply, or they become too distressed, maybe people with dementia or who can't give consent. So they might move and then be self-isolated. Some of them may well have become unwell, but I don't know whether that would have been because of an infection within the care home or in the hospital from where they have come. So we don't have that data, no.
Okay, thank you. And did you have a second question, Carl?
Okay, thank you. No, and I appreciate, Chief Officer, that we are following the guidance and we're not setting that guidance, but it was more just to clarify that that is still happening in some instances. The second question was on the statistics that have been circulated, one of which was about the number of care home staff that have been tested, and I think that was 203 was the number of staff that had been tested in the statistics that were circulated to us. I was just wondering what the total workforce was that we were including in the availability of these tests, and therefore what percentage of the workforce that was.
So the numbers of tests been undertaken. These are the staff from the independent sector that we've cited in that second page of that data report, and that's 203 staff from independent and third sector care homes. They have been managed through our commissioning team because of our contracting and commissioning role with the independent sector care homes, because we place people in the care homes and because we continue to have a duty of care in terms of residents. There has been significant additional testing carried out across Tayside with staff who are either working in health or social care or who are other key workers, and the numbers are very, very significant. I don't have them to hand. I'm not sure if that's where your question was what you were looking for from your question, Councillor Purvis.
I think it was specifically to get an idea just of the percentage of the independent care sector that had been tested, because obviously in Perth and Kinross and indeed in many other places that makes up the vast majority of the care home sector through the commissioning model. Yeah,
I mean, I have to say that the numbers will have increased and will continue to increase, because what we're now not doing is waiting for people to ask for tests. If there are outbreaks or if there are positive cases in care homes, then staff are being tested, and a much more proactive approach is being taken now in May, throughout May actually, and into June. What we're seeing though is the effects of the flattening of the curve and perhaps a reduction in the prevalence of the pandemic, and that would explain any drop in the numbers. But we can give you an indication offline of what proportion of care home staff, 203 people or however many being tested is what percentage, and we can update these figures in due course, and indeed I have a request to provide similar information to the Council's sounding board on an ongoing basis.
Thank you for that, Gordon. Thank you. Okay, so I'm conscious it's now 4 minutes past 3. Kate Bell has joined the meeting. Welcome, Kate. We have one final question now from Ronnie Erskine, and thereafter I propose to take a short 5-minute comfort break, and then we will return to the mental health services presentation by Kate. So Ronnie, your question please.
Thank you, Eric, and thanks for the update. Gordon, apologies for missing the first few minutes. I wanted to make one comment and then ask 3 questions, which I'm hoping are not going to require lengthy answers. The first comment relates to the introduction and your recommendations, and it's just to endorse what you've said there around noting the extraordinary effort, adaptability, professionalism and compassion of HSCP staff. I would certainly want that point to be noted and minuted, because it's through these efforts that we are getting through the difficulties that we've been in the last few months. I guess I have one question relating to that and 2 questions relating to page 8 and 9 further down. The question on the staffing side relates to skills and training. you talk about adaptability. I'm looking for some assurance from you that where staff require to acquire new skills or to be trained, that they've been able to access that training. The other two questions I have, if I skip down in my screen, relates to, yes, the comment on providing additional funding or staffing in response to critical situations. Is there any situation over the last couple of months where you haven't been able to provide staffing or ensure that funding was in place in a critical situation? So again, looking for a bit of assurance on that. And the last question is probably as long as a piece of string, really, and it's about lessons learned, really. Is there anything in particular you think that you and the team have gone through that we can learn from in advance of a second wave, should we be unfortunate enough to experience one? So I appreciate that's 3 questions. Eric, I've kept it as short as I can. Thank you.
Thank you.
So in terms of access to training, there have been opportunities for staff to be retrained, to be able to access training, both in relation to council staff who've been retasked into the Health and Social Care Partnership, NHS staff who are either returning or who are doing changed roles. We had a degree of preparedness. We moved some of those staff before the surge happened, so a lot of staff were in shadowing opportunities before it became a real thing for us, and we had equipped through the work of the matching unit, and colleagues deserve enormous credit for that. We had redeployed staff before significant pressures were brought to bear. In terms of staffing and funding in relation to critical services, I am not able to recall any situation where we were unable to provide what was needed to mitigate the risk in particular services. Bearing in mind that we had already positively taken a decision that some services would need to be stood down or need to be delivered in a different way, that enabled us to mobilise a resource and a capacity that we could deploy swiftly in those situations. Funding is a different issue because we have spent money that we don't have in anticipation that we will be reimbursed. The Scottish Government has given a commitment in that regard. We need to very closely monitor the expenditure. We need to account for it. What we've done is we have offset the additional expenditure from money that we weren't spending on services that we weren't providing. So where we've moved staff, that hasn't been a pressure. I don't think that that's been an issue. I think we have to date been able to manage that, and we need to reflect on how that enables us to respond if there is a further surge. Lessons learned. This has not been easy. This has been a challenge. This has been really, really difficult at times for people. Early on, we were finding our way in terms of the command structure, in terms of our responsiveness, in terms of supporting people to work in new ways. At times when things have been bad, Hamish Dougal, I don't know if Hamish has been able to join us today, our Associate Medical Director, said, just think how proud we will be in 3 months' time when we can sit and have a pint in a beer garden and say how well we collectively stood up against this pandemic and how effectively we made a difference in protecting people from harm and risk to life. So, I mean, I tell you that story because we want to be in that position, because we are missing the connections with each other, and we are all working very well together remotely. But I think that is also an indication of where we want to be at a point in time. And as I said to Bob Benson earlier, creating that space to reflect on what made a difference and how do we capture it, capitalise it, and use it to inform the new normal. And then our recovery beyond that is critical. So we need to make sure that we're building that into our planning activities, and maybe with a bit of support from organisational development in terms of creating space, as well as delivering reviews into the activity that we've undertaken. That was a long answer. You asked for a short one. I'm so sorry.
Thank you. It wasn't an easy question.
Thank you very much, Gordon, and thank you for referencing pints and beer gardens. That's very timely. However, as I think that's the end of the questions that we have at the moment, so thank you for that and thank you for your report. Can we agree to note that report? I shall take silence as agreeing to note that report unless anybody comments otherwise. Thank you. Okay, we'll take a short recess now. It's 11 minutes past and we'll reconvene in 5 minutes time. Thank you. Please don't whatever you do, dial out. Thank you. Okay, I'm hoping everybody's back or getting back. We'll start in a few seconds' time.
Good afternoon, Chair. Can I ask if I'm visible enough? Can you see me okay?
I can't see you at all. Chris, can you assist there?
I can see you, Kate.
Kate, I can tell you you're pretty visible from where I can see.
Okay, thank you.
Oh, I can't see you. It's okay, I know what you look like. So,
Eric, you can only see 9 feeds at any given time, and it seems to be quite sporadic as to what ones you can actually see. So,
okay. Okay, well, hey, we'll move on. Okay, so if we're now settled back in again, thank you for returning quickly. We still have a significant part of the agenda to get through, but the next item is particularly important, that of mental health services, and I'm delighted to say that we are joined this afternoon by the new interim Director of Mental Health for NHS Tayside, Kate Bell. Welcome, Kate. You've had a busy day yesterday with presentations to the NHS board and to another group, and so thank you for agreeing to attend today and to give a presentation to this integration joint board. And I understand that you have tailored your papers and your intended comments to focus in as much as possible on the integration joint board's areas of responsibility and interest, but that you'll cover in general the progress that has been made in response to the Trust and Respect report by Dr. Strang. So can I just hand over to yourself to give a presentation, and members, if I can ask if you, during the course of the presentation, whether you have questions to ask, if you can flag these up, and if possible, not essential, but if possible, give a slight indication of the nature of the questions that you're wanting to ask, and I will try and group these as much as I can when we go to questions to Kate after her presentation. So thank you, Kate. Over to you.
Thank you very much. I believe someone was going to give me control of the screen so that I could use the slides. Would you like me to cover the paper first? I know you received the paper late, but the slides probably give a good context, and we can potentially come back to that if that's desirable.
Yeah. Yeah. If you just want to go ahead as you see fit, and I'm sure
okay.
IT people will help with as required.
Okay. If I have the slides here, if that's helpful. I'm not sure who your techie person is, but I did send them earlier. I can access them here and share them on my screen if that's helpful.
Please, Kate, that would be great if you could share from you.
Okay, let me just take 2 ticks to find them. So, can everyone see that?
Yeah, that's good, thank you. Yeah.
Okay. So, as the chairperson said, Eric, I have tailored them as much as I possibly can. There is probably about 15 minutes of slides here, and the key components are in the paper also. The slides don't cover everything. It's more related to the draft action plan, as you mentioned, which is called Listen, Learn, Change. And you should have received a copy of that action plan also ahead of today's meeting. So happy to take questions beyond the presentation. So for people who don't know me, I'm Kate Bell. I am the Director of the Mental Health and Wellbeing Programme for Tayside, which is why I came to Tayside on the 2nd of March this year. On the 6th of April, I was appointed the Interim Director of Mental Health in recognition that there was a leadership requirement in terms of grants. It almost worked exclusively on COVID-19, and we agreed that the priority would have to be continued in relation to mental health. So I agreed to step up to that leadership role, but I didn't lose any of the other responsibilities that arrived with either. So I'm leading on the Independent Inquiry Action Plan, the Mental Health and Wellbeing Strategy, and overseeing the leadership of mental health services currently. So it's an exciting piece of work. It's a good place to be at the minute, and I think we're progressing well. So this slide talks about, and people in this room will know more than I in terms of the history of this, but just in context, the Independent Inquiry into Mental Health Services was commissioned in May 18. The interim report, written by Dr. Strang, and I'm sure contributed to by many people in terms of 1,500 voices that were heard, came out in May 2019, and then the final report came out on the 5th of February. On the 27th of February, the NHS board accepted all of those recommendations and agreed to put together a draft action plan. In fact, at that time it was a detailed action plan back to the Scottish Government by the 1st of June, which is Monday coming. In the interim, we were unfortunately, we experienced the pandemic that hit us very early March. And in terms of leading that, feedback from people like your chair and the chief executives of the other organisations, it was felt that we would go back to government to ask for an adjusted timeframe, which I did, and the government agreed to in relation to the capacity that was available to participate at that time. So we have a draft action plan, and that draft action plan will be iterative. We've had significant input to it so far. It's probably more comprehensive than I expected it to be, but for this meeting and for note for the members of this meeting, it is a draft. So to date, just to give you an idea, one of the things that I normally do when doing these kinds of things, it's very complex in terms of who you communicate with and who you engage. So there is always for me a need to record that. So I asked one of the team to do some work on that and to give me some statistics that I could share with the board yesterday. The wider stakeholder engagement session that we had yesterday, which was very well received, and I hope some of you were in attendance at that, and with yourselves today. So this is about being open and transparent and working with as many people as we possibly can. So I'm delighted to say that the statistic came back that we have managed to engage 200 stakeholders over 65 meetings, and that has been with the restrictions of not being able to meet in large groups. But there has been significant input so far, so I'm delighted to be able to report that. The next slide is probably of interest to you as well. So by stakeholder group, this pie chart here breaks it down. So you can see, and I said this yesterday, that I think it's important for this room to see that the 9% of health and social care partnerships and the 28% of mental health senior managers probably represents the Integration Joint Board staffing around mental health. So I'm pleased to see that that is the lion's share and the biggest chunk of the engagement that we've done so far. So I met with the stakeholder participation group on a Zoom call on Tuesday, and I had read the report. I've read many different reports since arriving in Tayside. And I was struck by, again, the passion and the personalisation of the messages that I heard on Tuesday. We connected with 12 members of that group on Tuesday. Grant Archibald, the Chief Executive of NHS Tayside, joined me for the first 10 minutes to again give his commitment to the continued engagement with that group as a specialist interest group in the work going forward. So I just wanted to highlight again for openness, transparency, and the ability to say that these are the things that we will take forward. And it's only some of what everyone will know what is in the independent inquiry report. So again, people talked about the high number of locums in the service, and for them what that meant is that there is an inconsistency and a poor continuity of care, and that's, you know, indefendable in some respects. So again, it was just to highlight, people raised concerns about written communication to patients and family, that may be inaccurate. We've taken action on that one already. I spoke about that yesterday. Many reports from families also talked about treatment was good, staff were kind, but however, this was alongside concerns about lack of availability of a wider staff resource. Staff themselves reported and worked with Dr. Strang in the independent inquiry and reported feeling worried about patient safety. And again, on the reverse of that, it's never just one story, that both of these things will exist in any work group, that there is exceptionally caring, understanding and very wise professionals. So these are all words from the report. Challenges with staffing, particularly in psychiatry, some in nursing, allied professionals, and when we talk to local authority colleagues, we know that there may be some challenges as well around mental health officers. And I was not surprised to see this in the report, because I think it's quite similar across Scotland, that maybe we do have long-winded recruitment processes. So that's something that I think from a workforce perspective that we need to look at from a Tayside perspective, to see how can we get recruitment and retention better in Tayside throughout this process. Again, really important, staff not feeling listened to. If we don't feel valued at work, then it's very difficult to get that motivation and to get the best out of staff. So we have to be listening to staff, and as it states here, if staff raise issues with us as senior managers, as a leader, at any level in the organisation, we have to take the appropriate action, and that means feeding back to staff as well. So there's a clear recognition in that report, and I think within the body of organisations in Tayside, the Tayside executive partners, that there's a recognition that service improvement is needed, and in the report it says badly needed. So again, just to put in context that the meaningful work that we have to do in relation to people with lived experience is where we need to start. So from my perspective, in terms of any change, complex change or whatever, whether it's a single patient, whether it's a population of people, we have to understand what the needs of the population are. So the stakeholder participation group wrote a really good report in December 19, and that, you know, explains the patient perspective, the family perspective, the carer perspective. And in, I think it was about 5 weeks ago, I received a summary paper which spelled out these 11 key summary points. And what we like to do with these key summary points is work them into acceptance criteria in terms of the work that we do going forward. Is that patients, families, carers, special interest groups like the stakeholder participation group, third sector organisations are able to recognise the work that we're doing based on not just these 11 key summary points, but building on that in terms of what does success look like for patients, what does it look like for families, what does it look like for communities. So again, taking back, all of the slides relate back to the independent inquiry and to the facts as they're written in the inquiry. There was an employee participation group, and on the left of them, what staff felt in terms of what they reported into the report. There was also a survey of staff, which Staff Side and Participation Partnership have shared the themes with me. So the block on the left talks about, you know, staff not being appropriately trained because they were coming in off bank, that some of the staff felt that they'd witnessed bullying and also experienced bullying, and that they didn't feel as if they had a voice. So on the right hand side, I've taken the opportunity to say some of the things that we've written already is that staff side communication and engagement is critical going forward, as critical as the voice of the patient in terms of the people that receive our services and the people that deliver our services. So on the left-hand side, there is a program within Scotland which is about mentally healthy working environments. I think we could all benefit, from that in terms of being respected at work. The report is well named, I think, in terms of trust and respect. It gives us a good platform to move forward in Tayside. In terms of that open and honest dialogue, we need to develop that compassionate leadership within our staff at all levels. Lead nurses are leaders, managers are leaders. If you're a leader of an admin group of staff, you're still a leader, and we need to, throughout the organisation, look at how we can get the culture to change if that culture is not what it should be. So I think together we can listen, learn and change. But to do that, we need to raise awareness, and I suppose it's everybody's job in this room, as it was for the people yesterday, and for each of the people that we've engaged throughout this process, that we tackle stigma, that we look at reducing that and eliminating that where we possibly can, that we create support structures for people with lived experience. It was interesting in the call on Tuesday, some of the people who were on the call who've got experience of mental health services, and some of the families who've been bereaved in the past talked about the support structures that would help, but also some of the processes that might help, in terms of improving assessments, improving closer working with families and carers. So that's what we can absolutely agree to take forward together. That we provide safe spaces, and by safe spaces we mean that it must be okay to talk about our mental health, because it's not just some people who have mental health, we all have mental health. And for people who have mental health conditions, it's really, really important that we see that as something that we can support and that we can understand and that we can all talk about. Therefore, no one feels alone in that, and that we reduce that stigma around that, so therefore people don't feel the isolation potentially that they may have felt. So I think working together we can generate these ideas and generate hope in Tayside that the future of mental health services can be better, can be improved. And David Strang talks about the opportunity for that to be world-class mental health services. I think it's everyone's responsibility to take that forward. So you'll have seen the draft action plan by now, and I set this slide out yesterday. It's an attempt to talk about the 5 key themes that were set out prior to my arrival in Tayside. What I've done is taken each of these recommendations and put a number against them and put a timeline against them in terms of when we think we can do the work by. I have given some indication of quite an ambitious, set of milestones. That we achieved the first milestone yesterday by agreeing the draft action plan will go to the government by the 1st of June. We're working towards October in terms of the potential for a draft action plan. And our hope is that by December, having undertaken significant, engagement on the draft, that we could move forward to publish a Tayside-wide mental health and wellbeing strategy. So that would include all of the recommendations that you see here. Second slide talks about the remainder in terms of the other 2 strategic themes, and there are 2 key actions that are not for Tayside. These are for the national recommendations, and in particular for the Scottish Government. So I set out the draft action plan in this way to ensure that we capture as much information as we possibly can. So this is just an example to say that recommendation 1 is to develop that new culture of working. And I've talked about some of that in the previous slides. And I've given a key lead for that, and the Chief Executive NHS Tayside has said that that would be something that he will take forward. He will work with the various groups, staff, divisions and teams within Tayside and ensure that we can have a bottom-up as well as a top-down approach to that, and that culture change includes everybody. There isn't people out there that need to change, I think is the clear impression. I think everyone has to change. As culture talks about, what should it be like to work here? What should it be like to live here? Do people bring themselves to work? It's interesting when people talk about their values, that we have professional values and personal values. So there's some interesting discussions to take forward on that. We've got a milestone for that in terms of what does the organisational development plan look like. July and August have been set for both of these things as to how we communicate that. The outcome that we're looking for is that we do have a mentally healthy working environment for people. So that will be a milestone and an outcome for people to look to. Each of the recommendations have actions in terms of the implementation plan that's been proposed. And again, these are draft and can be added to. And I've also given them a RAG stating in terms of where are they at the minute. So this one is amber and is being worked on. Second one that I've chosen to give you an example of, again, just to see how far through this we are, to conduct an urgent whole system review of mental health and wellbeing provision across Tayside. And the key thing of this is that there's been suggested that we have a mental health and wellbeing strategy for Tayside, which is system-wide, population-wide, is from pre-birth to old age, and looks at every mental health service in Tayside. And I think the expansion of that scope has talked about that this should also be about public health, it should also be about prevention. And we should be looking to our third sector partners in terms of the massive contribution that the third sector make. So that membership of that mental health and wellbeing strategy board will be representative of those key individuals and key organisations that will allow us to co-create, to design and develop a strategy. Is it for the next 10 years? I put that stretch on it. It's 2021 to 2030. Is that too long to plan? These are all questions that I think we have to work together to consider. So each of the recommendations has that makeup. It's the third recommendation. I've kept this one in here because it's important to you today in terms of reviewing the delegated responsibilities across Tayside. So there's been an agreement that the integration schemes that I think are coming up to a 5-year limit. The Minister asks that within 5 years integration schemes are looked at, and I'm sure I don't have to tell you that. So there is an action proposed that we undertake a review of the integration schemes, and we can do this by August potentially in terms of the work that needs to be done. And obviously the people in this room, chief officers and others, would need to identify who are the key people to take that piece of work forward. There's a discussion that could be complete by September 2020. So this sets out just maybe some of the methodologies that we could use around delivering that new culture of working in Tayside in a very collaborative way, to consider that whole system approach. And just that there is a range of change ideas that are in there that people have suggested, that they've come up with. It's just a way of collating information really, and then to look at what is driving that, what are the kind of secondary things that are driving that, and what you would want to deliver. So in terms of retaining and attracting trainee psychiatrists, to complete their training in Tayside, we've already got some good evidence of that, in as much as that I think it might be 3 or 4 of the staff who are in training, are considering taking up permanent employment in Tayside, and that has to be, an excellent piece of work. I know Dr. Mike Winters is working very, very hard with the medical staff and supporting the trainees, as is Keith Russell and others, in relation to how they work with junior doctors. So some of these are well set out, and it just gives an idea, an indication of how we can start to put information together and to share that information, and then to consider, are these the right things to do? So Dr. Strang in the report in Trust and Respect talked about adverse events and how they are managed, clinical governance, where are people within that in terms of how are families, carers involved in adverse event reporting, how that information is captured, how that information is recorded. So I've taken out that section in particular to say that that's an area that I think we have to focus on. And we've done some work with that already in terms of our clinical governance within the NHS Tayside, and that conversation has to be taken out in relation to who else needs to be involved in that discussion and debate. This is the Tayside NHS Board Governance Framework, and again, my challenge to people is, where does mental health sit within this? So I've added a block at the right hand side of that doesn't really exist within the schematic, to say from a mental health perspective, there are quality performance reviews for health and social care partnerships. There are some for inpatient services, I'm sure. So again, it's how do we do this well, and how do we connect everything up so that people don't fall in between. So in terms of how we move on from this, I was saying this yesterday, there is a bit of a proposition for people to consider, that the 51 recommendations in terms of the independent inquiry have an absolute interdependence with the mental health and wellbeing strategy. So by doing these things, we will be able to progress in terms of the clinical service model for mental health, how community focused that is, how acute focused it will be going forward, in terms of the driver to be less reliant on acute services, and for people to get the care where they most require it is in their communities, around that 94% of work that is carried out in communities. So do we have an independent inquiry delivery board? And if we do, who takes that forward? How is that delivered? We've named people within the draft action plan. Should those people take that work forward and report into that independent inquiry delivery board? We've got the Tayside-wide executive partners group, which we call the strategic leads group, which have agreed to take that Tayside-wide approach. Would this be appropriate governance to set around that? And following on from that, there is a need for us to consider the reporting arrangements around how would this group and the Mental Health and Wellbeing Strategy Board feed into the Integration Joint Board. How often would they report? What would the frequency of that look like? And what would the reporting requirements be? Having done this in other areas, there was 2 Integration Joint Boards, there was community planning forums, there's the NHS board. There was an agreement that there was a requirement to report to all of those, and also into some of the executive committees within the local authorities, in order that mental health is everybody's business, so we have to find a way of including everybody. So it's whether that independent inquiry delivery board will be chaired by Grant, or potentially by someone else that would be part of the Tayside Executive Partners Group, to be decided. So that could be a programme 1. So it's to think about and to get some feedback on. And we have programme 2, which some people in the room have seen this schematic before. It's a proposed scope for a single whole system change programme, a mental health and wellbeing strategy for Tayside, looking at good mental health for all, a population approach to mental health, looking at community mental health services, and that might be specialist services, it might be services through your general practice. What are the community teams doing in terms of primary care mental health teams, and looking at access from within the EDs, within the emergency departments in relation to mental health, which across the country is a bit of a problem when people present to ED. There isn't a clear pathway through, and sometimes the specialist resources in terms of mental health, liaison nurses or liaison psychiatry are not available to people. And in terms of suicide prevention, does it sit there in terms of a project under the community? Does it sit in prevention in terms of good mental health for all? These are questions that we have to consider going forward in relation to who do the integration joint boards identify, who do the health and social care partnerships identify as key people to be a part of this work going forward, so that it's influenced in the right way. So we've got a work stream there on children and young people, which again is a given in relation to the work that's been done nationally. There is a change in the specification as to how mental health services for children and young people will be delivered. There's a need to consider the whole system approach in relation to the supports that young people and children will receive in schools. So there's a clear steer that should be a whole system model for children and young people. And then we talk about specialist mental health services, and there are a range of things that have been done already within the Tayside Mental Health Alliance. Looking at community mental health teams, how they operate, crisis care and home treatment. Where does that sit? Does it sit as a specialist service? Should it be a preventative service? We've already started to talk about distress brief intervention programmes within Tayside. Where would that sit within a programme like this? So again, we've got some cross-cutting themes there around governance and leadership. We need to look at what does the governance and leadership for this look like. And I was asked a question yesterday, and this might preempt someone's question around the governance around this is a programme governance. It's a temporary programme that we'll put in place maybe for the next 2 years to design, co-develop and produce a mental health and wellbeing strategy. You would then have to consider what's the delivery element of that. Do you keep something like this in place in terms of the implementation? So those are all questions and all decisions that we have to take together in relation to. Some of these are givens. One of the key questions I think around for people that is emergent is where does learning disability sit within a programme like this? Where does dementia sit within a programme like this? Dementia has its own national strategy. So we're at the beginning, many questions. We have to put up some of the things that feel in relation to a Tayside-wide mental health and wellbeing programme that would be clearly work that Tayside would want to do and would need to do in terms of how we describe that. So the key proposition is that we either have 2 programmes or we roll these and merge these programmes into one. So we do the trust and respect draft action plan. I said I had a call with the government this morning. I've said to them that in terms of this being an iterative piece of work, I think over the next month, we'll look to get feedback from people on the draft action plan to bring that into a way that we can have some consensus to the content of that and to propose that we merge that with the Tayside Mental Health and Wellbeing Strategy Board, and the work gets done by one single group as one single programme. And that whole systems change redesign programme we are able to start in June, July. Some of the work has already been done, some of the work is work in progress. I don't think Tayside are at the beginning of any of this. So therefore it's a case of how do we consolidate the work that Tayside want to put into a change programme for mental health and wellbeing. And alongside that we put an infrastructure in place that the leads of each of these areas of work would work with me and potentially some other authors to look at how do we then describe that into a mental health and wellbeing strategy for Tayside that could be launched sometime in January 21. So we take on board some of the themes of the trust and respect report around quality improvement, learning and care governance, and these would be business as usual functions, and we'd be looking at how will that influence mental health and how will mental health supports influence that. So again, key, I've just noticed a spelling mistake. Key to this is the culture, engagement, communication and recommendations, not mandations. So all of this is potentially, has the potential to roll up into one programme so that we can all work together. Our capacity, even over the next year with COVID-19, in terms of the new normal, may be challenged around some of this as well. So just next steps then, we considered this with the Tayside executive partners on Wednesday. Was it Wednesday? Yes. On the 27th. We rolled it out with the board yesterday and with the development session and with yourselves today. And what we'd like to do is to put this to the Scottish Government as a proposal that we merge the action plan into the future work for a single Tayside mental health and wellbeing strategy. So I'll leave it there, Eric, and I'll hand it back to you.
Thank you. Thank you very much, Kate. That's an enormous amount of work that has clearly been going on in recent weeks and months, and thank you for that, and thank you for coming to present today. I'm looking to go through and allow as many questions as we can, but can I ask please that the questions are kept as succinct as possible, so that we can give as many people the chance to ask questions. Clearly, this is a work in progress situation that is presented to us today. It's not a finished article, far from it, and so we're looking for feedback as well as we go through these questions and comments. So if I may, can I start with Councillor Purvis? Thank you.
Thank you, Chair, and thank you for your presentation. I suppose the first thing I would say is that it is not really ideal to have only had the paper yesterday if we're being asked to give feedback today, and also some of the things that were mentioned in the presentation were not mentioned in the paper. So that would be my first point to make. In terms of my questions, I have a few distinct ones, so I'll ask them separately if that's okay. The first question on governance is, I was disappointed to note that in the paper, there is no mention in the substantive paper of Perth and Kinross Integration Joint Board, and I think only one, or certainly very few, references to Perth and Kinross Integration Joint Board in the action plan, notwithstanding the changes that the Minister has announced in relation to operational management. It is the case that Perth and Kinross Integration Joint Board retains strategic planning responsibilities for inpatient mental health services, and indeed that community mental health services strategic planning responsibilities continue to sit with the 3 integration joint boards across Tayside. So I'm just wondering why that doesn't seem to have been taken into account in the working up of this action plan, and also in addition to the points you made referencing them in your 2 programme suggestions, how you would envisage that the Integration Joint Board in Perth and Kinross can fulfil its responsibilities of setting the strategic direction as part of this process.
Thanks, Callum. Kate, would you care to respond?
Yeah, I don't know if you heard the end of that. I didn't hear the end of the question.
Can you repeat that, Callum? Sorry, just the end of it.
How far did you get, I suppose, is the... What did you get? And I can tell you.
Sorry, I heard most of it. Why don't I answer what I can, Mr. Purvis, and if I don't answer the key point, you can come back to me on that. So I guess in terms of the governance arrangement for this, Tayside Executive Partners have detailed what the governance arrangements will be. So what you see is a reflection of the agreements that we've reached with the Tayside Executive Partners, and Perth and Kinross being one of those. There is an equal representation across each of the partners in relation to the programme governance around this. That was established in January 2020 with the joint statement of intent. So if that covers the governance arrangements around that from a Perth and Kinross point of view.
I think the issue here is we need to draw the distinction between Perth and Kinross Health and Social Care Partnership and Perth and Kinross Integration Joint Board. At no point has Perth and Kinross Integration Joint Board, this body that we're meeting today, have we given authority to the Chief Officer or indeed to the Chief Executive of Perth and Kinross Council to make any such agreement to agree a governance structure for this process. Therefore, my specific question is, how do we continue to discharge our strategic planning responsibilities if it seems that we have been excluded from the initial development of this plan?
So I would ask that potentially your Chief Officer, would answer that question instead of myself. The issue in terms of the plan is that we have worked through the Tayside Executive Partners, and to give the Chief Officers and others their due, COVID-19 has not allowed us to engage with the Integration Joint Boards in this way until today. So in normal times, we would have had those conversations face to face. If I had been, arriving in Tayside to start this work, then absolutely we'd be looking to the Integration Joint Boards to work with us as we would the community planning partners and others. On my arrival, the key governance group around this were the Tayside Executive Partners. So Gordon, Karen are the people that we've been working with closely, and obviously Councillor Drysdale sits on the board and will have been involved in the discussions around that from an NHS Tayside board point of view.
Thank you. Thank you, Kate. And can I ask Karen Reid to come in just now, just to pass a comment from her perspective as a member of the Tayside Executive Partners?
Yes, thank you. And firstly to Kate, thank you for the presentation, and indeed thank you for all your work that you've done since you joined NHS Tayside. I think we're getting slightly confused about roles and remits, and we discussed this at the Tayside Executive Partners meeting earlier this week. The Tayside Executive Partners signed up to the Statement of Intent in terms of the improvements that we collectively wanted to see for mental health services across Tayside. We have been at pains to state the roles and responsibilities of both the 3 councils and indeed the 3 integrated joint boards. So we were not in a position to agree the governance structure as it stands, and I need to make that point crystal clear, and I'm sure if my colleagues were joining us they would say the same. I think, Kate, the other thing to point out is that Councillor Purvis asks a particularly pertinent question around the Perth and Kinross IJB retaining the strategic planning function, and my recollection, certainly from having that same question with both yourself and the Chief Executive of NHS Tayside earlier this week, I think that's the intent, is that the strategic planning function would remain with the IJB. Secondly, the hosting arrangements that are currently in place, I appreciate the integration schemes do need to be re-looked at, but the hosting arrangements straddle all 3 IJBs. And my final point in relation to governance goes back to your slide, and my apologies, I possibly should have picked this up earlier, but NHS Tayside, our lead partner in terms of reviewing the integration schemes, it would be for NHS Tayside and all 3 councils to be the lead partners to review the integration schemes. So I hope that clarifies. I think there's a bit there that we still need to work out, and Councillor Purvis's points are well made in terms of just sorting out the governance arrangements and making sure that we're paying heed to the ministerial direction, which is absolutely important, but equally so, we're not undermining how the integration schemes or indeed the legislation is set out, and we get to a successful resolution in relation to governance, but most importantly, actually we see the traction that we all want to see in improving mental health services across Tayside. Thank you, Chair.
Yes, I mean, absolutely. Thank you for that, Karen. And I think it is, you know, in terms of the next point in the question, in terms of Councillor Purvis, absolutely the planning and strategic commissioning would be unaffected by, you know, any of these arrangements, that would remain the same.
Thank you for that response. I suppose just as a follow-up to that, many of the things that were referenced in terms of the recommendations in Dr. Strang's final report are strategic in nature, I would argue, and certainly there is a role and remit for Perth and Kinross Integration Joint Board to have that strategic planning role in any of those discussions. I know that at the last meeting, and appreciating the current circumstances, the Chief Officer might not have been able to do this, but we did ask that he seek further clarity and provide the IJB with an update on the future governance arrangements. So perhaps if he isn't able to provide that update today, if we could ensure that could be done as soon as possible, perhaps in advance of any decision to send something to Scottish ministers. That wasn't another question, that was maybe just a point.
Yes, so
is that all right?
If I could come on to the final part of your question in terms of the operational management arrangements, and it is mentioned in the paper, there is still work ongoing in relation to how we will apply that. The Minister for Mental Health has made a statement in Parliament on the 11th of March, and we've been working with others to look at the detail of that and how that will be applied, but again to provide assurance that it will not affect the planning and strategic commissioning within the integration joint boards. The paper that we've worked up with the Scottish Government Integration Unit clearly states that it is around general adult psychiatry inpatients only and doesn't relate to any of the community services. So again, those are important points to make, and I guess in terms of the Minister's statement, it's an instruction to the Chief Executive of the NHS Board to go ahead and do that. And just as recent as this morning, the Minister is looking for a date for when that will be effective. So that is something that the Chief Exec and his colleagues were in discussion about in terms of reaching agreement on that.
Okay.
Thank you, Chair.
Yeah.
On to the next question about the Mental Health Alliance. This was referred to at the last meeting of the Integration Joint Board that we had, and there was an understanding that perhaps a new body would be required, and I don't think anyone disagreed with that if that were deemed to be the most appropriate course of action. I suppose one of my concerns is that we did maybe spend too much time, but we did spend some time looking at terms of reference for that Mental Health Alliance. I'm just wondering whether there's an intention to do anything similar for the Mental Health and Wellbeing Strategy Board, and whether, again, Perth and Kinross Integration Joint Board will have the opportunity to comment on that to ensure that the governance arrangements are in place.
Stage of that is to expand what was the membership of the Tayside Mental Health Alliance to include third sector organisations more, to include people with lived experience, carers and families, and to consider what a configuration of that might be going forward. And again, the representatives from the Integration Joint Board who will sit on that will have access to those terms of reference, and therefore in terms of the decision-making bodies that they work with and work to, you would expect that there would be comment coming back in terms of the configuration of that. I wouldn't want to get bogged down too much in that in relation to its programme governance, is how a programme of work will be taken forward in relation to that. So therefore we have to merge that and work with that in terms of service change and service redesign, but also work within the financial guidelines for all of those organisations.
Thank you. And just to follow up from that point, and maybe to give you some of the background, appreciating obviously you're new to the role, I don't think Perth and Kinross Integration Joint Board ever got to the stage of formally agreeing in terms of reference. We were still going back and forward, although the group was already operational. So I think the issue here is that we have not given our consent to that to be the vehicle that's taken forward, even if it is adapted. So we can't base it on that thing. We need to make sure that there is still that engagement going forward. And the final crucial key point, which is something that we raised at the last meeting of the Integration Joint Board in Perth and Kinross, was that any such group, we are very keen to see that it does not have a professional bias, so that the carers, the service users and various other groups and the stakeholders that are involved are not outnumbered by the professional people on that body. It would be useful if we could perhaps have an assurance from you that that is your intent with taking this board forward. Thank you.
So I'll certainly take your point out with the meeting in terms of consent and approval, in terms of reference for the Integration Joint Board, and work closely with people to ensure that we can get a joint agreement on that in terms of what that will contain. But I can absolutely assure you that the configuration of the mental health and wellbeing strategy going forward will put people first in terms of those communities, those individuals, those organisations that we have to listen to. If we have to create subgroups, in terms of, when I've done this before, people have felt that it's tokenistic to have one or two people on a big committee where confidence levels are maybe not the same, or information levels are different, in relation to how people communicate. So I'd like to respect that in terms, and I've asked people from the stakeholder participation group, and I would continue to do that in terms of people who identify themselves as interested in this work, to say, how would you like to be involved and how can we support you to do the best you can to influence this work going forward. In the past, that has meant having specialist interest groups so that we can engage people using appropriate methodology, but absolutely that it would be proportionate. In order, we have to have specialist staff involved because there are specialist areas of mental health. But what I've done in the past is to ensure that we all use plain English, that we don't use jargon, we don't use technical language, and if we do, we explain that in some way. There is just a need for people, everyone to be equal in their contribution to this, irrespective of where the demarcation sits. So I would like to give that assurance, and I'm happy to be held accountable for that going forward.
Thank you, Kate. Okay, if we can therefore move on to Councillor McDade has a question. Sander, are you there?
Sorry, I'm having a fight there with my IT. I think Karen Reid was ahead of me in the queue, but I'm happy to go now. So I have a couple of questions, if that's okay. Thank you very much, first of all, for your presentation. This is obviously a very important issue for the IJB, as it's for NHS Tayside as well, and the council and other partners. And obviously there's a long backstory to all of it. Just before I ask my questions, I've already asked the clerk if they can share your presentation online afterwards, just so that it's available for people, and if that's okay with you, that would be great. So one of my questions is around, obviously there is a long backstory to this, so what elements of existing redesign programmes are going to continue whilst continue being progressed whilst a new strategy is drawn up? So I'll ask my question separately, if that's okay.
Yep, I think in terms of the work that was undertaken by the Tayside Mental Health Alliance, the only reason that was paused was because of COVID-19, in order that we could exclusively concentrate our mental health resources on that. So I don't think that the work there in terms of around the learning disabilities improvements, there have been a stakeholder group working on that. As we can get people back when it's safe to do so, I'm sure that group will come together to look at that again. So there was a number, I think it was 5 work streams that were under that, and we're given an assurance that those would be merged into the future mental health and wellbeing strategy going forward. And that's why the governance arrangements, the scope and the scale, the proposed infrastructure that you saw on the slide has some of that already implanted in there to get into that discussion and debate with people as to where these things sit. In terms of the backstory around the redesign that was paused, as a result, I think it was after a year, the interim report came out. I think in terms of what I would be looking for and what I've encouraged people to do through the draft action plan is that in discussion with David Strang, and we set up a working agreement with David Strang, that he and I will meet on a monthly basis and we'll have that ongoing dialogue, just to make sure that I'm clear in terms of what the people that he spoke to meant by that recommendation. Are we getting it right, and are we doing the right things? So in terms of the whole systems redesign, my understanding from David and my proposal to the Scottish Government, given if there is a confidence that we have, that we're moving in the right direction and that we have a robust infrastructure, and the clear intent is there to take this on and to do it well and to do it in a disciplined way, is that whole systems redesign is that we look to start that first, and some of the early actions in that are to review any redesign programme that was halted and to look at where that is going forward. So how will we configure a rapid review of that in terms of where the original intentions, the right things to do, if they were, how do we go ahead and implement that? So there's an absolute transparency to all of this, and I suppose the discussion with Dr. Strang was really about his intention to say that any of the review, which I think people have talked about in terms of being a movement of beds, was not a transformational change, and his view was that you need that whole systems strategy to understand what your reliance is on acute services and acute mental health inpatient, and what the capacity and capability that you need to develop in the community. Therefore, what is the service model and the clinical models, and how do you engage and involve people at different levels in different organisations? And that comes back again to your planning and strategic commissioning. How would we use our mental health resources differently in future? So there is an opportunity, I think, in terms of the coming weeks and coming months as to how we start to configure what a whole systems redesign looks like. Hopefully that answers your question.
Thank you. I think it answers part of my question. I think obviously there were recommendations in the interim report which which was to pause the then ongoing redesign, which didn't then happen, and I think or was chosen not to happen at the time. I think there's a lot of obviously a significant part of the document, the trust and respect document, is around public concern and perception around these issues. I think we need to be really, really clear about who does have responsibility, because it's quite hard to understand if you're involved in this stuff and have been for a number of years, as I have, as to whose responsibility each area is. But from the public point of view, they care less about who's responsible for it so much as actually what is going to be implemented and how it's going to affect them. And I think that's why the service user and their family representation on groups is really important. And I think it can't just be sort of like focus group engagement. They need to be in the room where the decisions are being taken. I think that's really important. Something can be said in one group and then it changes in another one. So I think it's really important that they are embedded in that. And I think coming back to the earlier statements from Councillor Purvis and Karen Reid, the Chief Executive of Perth and Kinross Council, there had been ongoing discussions around the structure of the Mental Health Alliance and the membership of that. And I think there is a concern probably still around the membership of some of these groups going forward. So I'm pleased and reassured by what you said earlier about increasing the stakeholder representation. I think in terms of, you mentioned earlier about not having had a chance to have a dialogue with the IJB, but you did mention that you'd had you'd consulted over 200 people over 65 meetings over the last sort of 2 months. So it might be prudent for us to perhaps have an engagement as one of the significant bodies going forward, that we maybe have a session to discuss some of the strategic aspects of it. I think that would be helpful. And I think just from my point of view, I wanted to ask you a question around in terms of the stakeholder engagement, what do you see as that engagement happening? Because you talked about, obviously there's been a big change in terms of COVID. Do you see a delay essentially happening to adjust for COVID around some of this, so that all of the appropriate stakeholders can be consulted, whilst obviously we're all cognizant of the need for some change, and that might delay, come back to my earlier point, might delay some of the planned changes that were already in motion?
I think you kind of stole my thunder a bit in terms of one of my recommendations to the IJB is that we do have a session, potentially just concentrating on the draft action plan. That may be something that we can do in future, but we could extend that agenda to include other things. I would hope that in terms of engaging yourselves with other people that I work with too, in relation to the governance issues, so that we can work out what is best in terms of not just this integration joint board, but the other two also. But in terms of the public perspective and the engagement and any delay, I'm hopeful that the session that I had with the stakeholder participation group on Tuesday was very meaningful. It was productive. We got through a lot of business. It would really be up to how can we use the digital platform in a way that would allow people to have meaningful engagement. And I said this at the development session, the stakeholder engagement session yesterday with board members and others, is that if this is the way that we are going to work, I would like to keep the timelines and the milestones, as they are, and report stage by stage if we're starting to see delays and if people are feeling as if they're not being engaged enough, and that what is coming out of the work doesn't really reflect what people's aspirations and expectations are. So there is a whole host of ways that we can engage people in smaller groups. It would take a greater resource to be able to do that, and to use social distancing and potentially do some face-to-face work with people going forward. So the communication and engagement plan for this is going to be really important in terms of all of the different methodologies that we'd like to put in place. And again, we'd have to engage people on that very plan itself as to whether these are reasonable measures to take going forward. As we do the work in between those meetings and feeding it back out to, you know, a whole host of a network of people, it will be a big job to start to collate all of that back. Whereas it's different if you're in a large group and you have a stakeholder engagement meeting and you put it all up on flip charts, and we do, you know, all of the work that we do and we have done, you know, in the past with larger groups. We then take that away and write that up and give that back to people, and people feel as if they've been engaged in the process and they've been listened to, and they then see it in the action that is taken forward and reported back to them. So I think we need to do our best with the circumstances that we're faced with. And again, it's really up to people in terms of the assessments that people make on the outputs of that as to whether it is good enough or not.
Thank you. I think that's really important about the to regain the public confidence that we do have. People do feel ownership of it, so I think that's welcome, and I look forward to hearing more about that, and hopefully we can get increased service user and family representation.
I think, yeah, thanks, Xander. And on that, it might be useful, I know, and apologies to Karen Reid for missing out her question, and we also have Ronnie Erskine to ask a question. But I wonder if, just while we're on this this discussion about stakeholder engagement, it might be useful to hear from Maureen, who's on the phone, in terms of, you know, she was part of the stakeholder participation group, and you know, how she feels about the level of engagement that she's experiencing. And if while you're on, Maureen, if you wanted to ask any question briefly, that would be good. I'm conscious it is 4:20 almost, and I'm looking to have this meeting finished by 5 o'clock. So if we can be very, very brief, that would be helpful. Maureen, do you have anything to, you know, just your comments on your experiences on Tuesday?
Maureen, if you could press *6 on your telephone to unmute yourself, please.
Just to say, if Maureen isn't able to do that, I have received written questions from the stakeholder participation group that they weren't able to pose either on the meeting on Tuesday or yesterday. And my intention is to collate those and to provide written comment back to those people, and we'll get consent as to whether we anonymise those and put them onto the Tayside website.
Okay, that's helpful. Thank you. Maureen, are you able to speak yet? Nope. No, Maureen. Okay, apologies. We'll therefore move on. Karen Reid, with your question, please.
Thank you, Chair. Kate's actually covered this in relation to questions from Councillor Purvis and McDade, but there's probably 3 points I just want to reiterate so we're crystal clear. Thank you, Kate, for confirming that this is about inpatient mental health. Thank you also for taking on board the point that the integration scheme review must be NHS, Tayside and the 3 councils as lead partners. And the final point I want to make is around governance, and we do need to have some discussion around the role of IGBs, councils and NHS Tayside in terms of governance, because IGBs in particular are not just consultees, they have statutory responsibilities. So we do need to do some working through of what the legislation says and give.
Hi, Maureen. It's noted that you're muted currently. Do you know? Did you hear what Chris was instructing you to do on the keypad?
Oh, sorry about that. Sorry if we've lost that. Are we back with Karen now? Is Karen able to come back in?
Sorry, I was just finishing off to say the governance role of the IGB, the councils and NHS Tayside need to have some further work, because the IGB councils and NHS Tayside all have statutory and distinct roles. The IGB is not just a statutory consultation in terms of a new mental health strategy.
Yep.
Hello?
Thank you. This is sorry, Karen, for cutting across if you weren't quite finished your comments, but we managed to have established contact with Maureen. Maureen, do you want to comment on your experience of the stakeholder participation?
Yes, well, yesterday I was at the stakeholder meeting, which was actually advertised until the day before as a development day, and then it was changed to a stakeholder engagement meeting just the day before, or a couple of days before. So this presumably might have generated more interest if stakeholders had known that it was going to be, you know, an engagement meeting rather than a development day. That was just an observation there. Then the draft action plan is going to the Scottish Government on the 1st of June, which is a very tight, but so how do comments that are made or concerns about it get changed before the 1st of June? It's a very tight schedule. Also, I would imagine that the things that are in the draft action plan would be affected by the COVID-19 situation, and possibly, you know, money being taken out of the mental health budget. And I wondered how that is going to be addressed in the action plan. And I think Callum actually asked another question I was going to ask about the carer and public involvement in the Mental Health and Wellbeing Strategy Board, and also the Mental Health Alliance meeting, which Bernie Campbell, the other carer rep on the IGB, and myself have been asking about for about a year now, because it's not just recently set up, the Mental Health Alliance. It's been meeting, you know, for the last year, and we still haven't, you know, got either of us onto that group, which we should have been on, I feel. So I just hope the same thing doesn't happen, you know, with the Mental Health and Wellbeing Strategy, but we should be on both these things. Thank you,
Maureen. I don't know if Kate, you're able to come back in on any of these comments, but your comments are noted, Maureen. Kate,
no, absolutely, and I'm sure you've recorded Maureen's voice in relation to that. So the fact that the development session for the board was turned into stakeholder engagement session, I think it came out in the invite, the late invite, I have to say, but there was key indications early on to the stakeholder participation group through Irene. In my conversations, I have weekly calls with Irene to state that it would be, you know, my desire that the stakeholder participation group could identify members. First of all, we talked about one person, and then there seemed to be an appetite for that. So therefore I was saying, so can we have the names of as many people who would like to attend? The chair and the chief executive of the NHS board agreed that the opportunity to engage people and to open that up to a wider range of people would be important. And the conversation took place that it shouldn't be a public meeting, but there should be key individuals and key stakeholders identified and invited to that. So that did include the employee participation group. It did include Dr. Strang. It included the stakeholder participation group members. And I'm pleased to say that 9 people from the SPG. So the reason why it went from a development session to an engagement session. In relation to the draft action plan, Maureen, I'd like to give you some reassurance that we have had various, you know, levels of input to that, but it is a draft, and we've agreed that we will do a specific session with the stakeholder participation group on the entirety of the draft action plan to consider, does it reflect the contribution that you made to the independent inquiry. So therefore, I'd just like to give you reassurance that the programme team, Leslie Roberts, I think she's on this call as well, is arranging for that to happen. So she's written to a number of people, if not today, it's an action that she has to take forward. So I look forward to having a specific session with the stakeholder participation group on that. And over the next 3 to 5 weeks, we agreed that we would report that back to the Scottish Government. And again, if it's not complete and it's not a final action plan, we can have that conversation again with stakeholders. It's important that we have a cohesive plan that is reflective proportionately. We're not going to keep all of the people happy all of the time, but it really should reflect the majority of views.
Yeah.
In relation to carer involvement in the Mental Health and Wellbeing Strategy Board, I'm happy for you to email me the 2 names, and Leslie will include those 2 individuals in the membership going forward, and we can work with you as to what the configuration of that needs to look like in terms of do we have a subgroup, do you sit on the main board, is that what you want to do? So again, happy to work with people to do what's best and what's in the best interest of getting those views across.
Thank you, Kate. I appreciate that, and thank you, Maureen, for your input there. As I say, very conscious of the time now, and but we have one final question, which is from Ronnie Erskine, and we have a comment from Sandra Auld. Thank you.
Can I speak? Eric, can I come in after that, just very briefly, Pat?
Oh, hi, Pat. Yep, surely. Yep.
Thanks, Eric. I think it's partly the comments have been overtaken by the answers, and I think it's good that we're thinking along the same wavelengths in some of this. But I think, having had the chance to look at the draft plan, I really welcome a lot of the work that's gone into that and the consultation. You can see there's a considerable amount of depth in there, and whilst it's helpful to have that considered further by the IJB, and I welcome that offer that's been made over the next period of time, we've got a good start there, I think. The communications around it, I feel there's maybe a bit to do yet around simple messaging, because the plan itself has a lot of complexity in it, and I think your man or woman in the street might struggle to follow what some of it actually means. So I accept that's a secondary stage, perhaps. I particularly wanted to commend the 2 pages on the views of people with lived experience and staff, which has come out of the Alliance, and then the page following that, the employee participation group, both of which have got numerous excellent points in them. And I think we've covered the staff engagement and the reassurance that we'll try and do some of that face to face, which I think again is listening and making sure that we're capturing the views that we want. I just wanted, I guess, a little bit of assurance on the staff side on the employee participation group themes. If you look at 3 of the words on the left hand side, and these words are staffing, as in vacancies, training and bullying. The actions on the right hand side are all quite generic and broad. I'm just looking really from an assurance from Kate, which I'm sure I'll get, that those 3 specific matters will form part of the actions that we take forward as we develop the action plan more fully. Thanks.
Ronnie, thank you for your questions and thanks for your complimentary remarks. They're well received. A lot of work has gone into the draft action plan, not just by me but by many people. So thank you for that, and I'll pass that on to people. I agree with you. We need some simple messages around this, and we've been talking about communication and engagement and how we get some clear lines of communication out to people in terms of what does it actually mean. And Karen and I spoke before, and we came up with it's the so what question, isn't it? We can do all of this work, but what does it actually mean? So I absolutely take that point, and it's something that we need to work on in relation to that. In relation to staff engagement and the specifics of the behaviours and the values and the culture, there is an ongoing piece of work that has been started already in Tayside by the OD department to look at leadership, to look at behaviours, to look at attitudes, to start to, already started, I think it's been going for maybe a year, in relation to specific groups of people as to what is expected in terms of professional behaviour. But I think I said this yesterday to people that it's just not acceptable, to be judgmental in any line of work. It's not acceptable to not treat people with respect and to have a dignified approach. The strategy itself going forward will describe it as a human rights approach, but there is a human being approach required in everything that we do. So I think in my time as the interim director of mental health, I will ensure that those kind of behaviours are what we encourage in staff. And I have a consistent meeting now with the employee director and your staff side rep for mental health, Alan Drummond, who I think is on this call as well. I don't know if Jenny is on this call, but there is a clear indication that, as with patients and service users and families, staff are extremely important. And it's important that staff want to come to work, that they're motivated to work. And when there's plenty of evidence, to suggest if you have a motivated workforce, then they will provide better care and treatment and, services and customer care, irrespective of the work that they are in. So personally, professionally, I demand a high standard from people, and I think that's something that we need to encourage throughout the organisations.
Thank you for that. Thank you. Sandra Auld, you have a comment to make.
Thank you, Chair, and also thank you to Kate for her presentation. It was just to re-emphasise that previously there had been discussion at IDB meeting regarding the representation of both carers and service users on the Mental Health Alliance, and there had been notification given that would be addressed. So it would be good if that was the case, and thank you to Kate for agreeing to that, but not just from the carer perspective, but also from service users as well.
Okay.
Thank you, Sandra. I'm sorry, Chair.
When you go, sorry.
Just to say that I'm not sure what organisation you represent, but yes, absolutely. And I think that the discussion that I had with Gordon over the past days was what can we do between now and your next, integration joint board meeting to potentially feed back on some of these things in a meaningful way, to say that we have 3 or 4 weeks to do these things, and I think they're very doable within that time frame. So we could potentially come back with a proposed membership for some of these and give you that proportionality. I know people had talked about 30% of carers and 30%, so it's a third. It might be difficult to do that because it's really important that we have proportionate representation, but we have the right staff in the right place at the right time to ensure that what we do is evidence-based, but it has to be based upon the requirements of the population also.
Okay, sorry, I've got Pat Kilpatrick with a comment, I think, as well, Pat.
Hello, can you hear me, Eric? Yeah.
Yes, got you. Yep.
It was really just to raise an issue about the third sector, and I think this is a really important part about the commissioning and the planning. And I remember the very powerful presentation that we had from the Men's Health Group. What was it called?
Andy's Man Club.
Yes, Andy's Man. I was going to call it Jimmy's Shed, but I knew I was close to that. So Andy's Man Club, and it was very good. It was very powerful, and it resonates with me on this issue of we're really only talking about change around the adult inpatient psychiatry in terms of the kind of operational management. But as I've said many times in meetings, and whether everybody agrees with me or not, my perception is that 80% of all mental health, or around that figure, it's an 80-20 thing. The majority of mental health is provided in the community and primary care. That's when people need the help, when they're living at home and they're in the community and things start to go wrong. That's when they need access to mental health services. And if we could try and get a focus on, and I know Kate is very committed to this, but try and get a focus even within the IJB about how we can commission more third sector provision, because they are closer to people, they are perceived as being more accessible. It's not something that's going to go in your medical records. You don't have to go to a GP practice and speak to professionals. You're just speaking to other people who have been through other things that are similar to you. So I suppose it's just to flag up opportunities to commission the third sector and to work more closely with them to make sure that we've got pathways in Perth and Kinross. We've got a lot of rural communities as well. So there should be a pathway everywhere for people that get into crisis, for people that are suffering severe depression, people that feel suicidal. So pathways everywhere that link the third sector into what provision we are making as a NHS and as an IJB. It's really just key really to consider them as providers, not just people to speak to for their views. Thank you, Chair.
Thank you, Pat. Thank you for these comments. They're very welcome. Okay, we've given a good proportion of the afternoon to this discussion, and I hope everybody feels that they've had the opportunity to ask questions of Kate and receive answers, and also to pass comments as appropriate. This is very much a work in progress, as has been indicated, and you know, there will be opportunities, and we will arrange these opportunities for fuller engagement on the draft action plan in early course over the summer weeks. And but in the meantime, can I just thank Kate for taking the time to be with us on a lovely afternoon, and obviously apparently it's lovely out there, I don't know, but thank you for your time, and very much wish you well with your continuing endeavours, and we'll keep in touch. And thank you everybody for their participation in this debate. So with that, Kate, I'll let you go out and get the
Thank you very much, and I look forward to working with you all. Thank you.
Okay,
have a lovely weekend, everyone. Bye.
Thank you. Bye-bye. Okay, everybody. Right, so we now move on to the light topic of finance and governance, well, finance in particular now. And Jane, you have provided 3 reports in relation to the 2019-20 position, the budget, and the additional COVID-related costs. I wonder if you can do your best to bring it all together, and then we'll take questions at the end, and endeavour to get this item of the agenda covered by round about 5 o'clock.
Thanks, Chair. No pressure then. I'll do my very best. In relation, first of all, to 19-20 outturn, I'm very pleased to bring this forward to this meeting. Normally we would bring it forward to a later June meeting, but we've worked hard to bring it forward today. Colleagues will remember that the IGB began the financial year with a £4.2 million budget deficit. A recovery plan was subsequently agreed, and a target position of £3.3 million overspend was set, whilst recognising that all efforts would be made to move as close to financial balance as possible. At the year end, and subject to audit, we are reporting an overspend of £1.798 million. Our work on financial recovery has supported this improvement in our position, particularly in relation to social care. However, over and above that, the significant improvement in the prescribing position is the main driver of our significantly improved position. Our quality, efficiency and safety prescribing programme has successfully offset significant demographic growth. However, over and above that, we've benefited, as have the rest of Scotland, in significant benefits from nationally negotiated price reductions and the national clawback of community pharmacy profit margins. So it's a significantly improved year-end outturn, but significantly driven by these unanticipated benefits on GP prescribing. Subject to audit, again, we'll carry forward earmarked reserves of 1.16 million. This balance is significantly reduced from last year, signifying huge investment in community mental health services, primary care and alcohol and drug services. It's probably opportune at this point to provide clarification on press coverage yesterday, which we assume to be a reference to our earmarked reserve set out in the 1920 outcome report. As I've already said, we are looking to carry forward £1.2 million of earmarked reserves. Within that, only £19,000 relates to community mental health services, a very small remaining balance of a significant Scottish Government funding to community mental health services to implement Action 15 and mental health strategy commitments. This small balance is fully committed. The COVID-19 report, which I'll come on to, also sets out the potential need to review those reserves, and it absolutely is incumbent on all public bodies in the face of huge increased COVID-19 costs to look at all opportunities, including reserves. However, I would highlight in relation to mental health services, only 19,000 of a significant investment remains. It's fully committed, and within the COVID-19 forecast costs, we include a further £100,000, which has been prioritised for the expected increase in demand for community mental health services as we enter the recovery phase. I'm happy to stop there for questions on the 1920 position, Eric, if that's helpful. Or if you want me to carry on, I'd be happy to do that also.
Are there any, if there are any pressing questions, there's somebody, and first on the buzzer is Ronnie Erskine. Ronnie, go for it.
Thank you, thanks Eric. Just 2 questions, and firstly, it's certainly welcome that we are seeing a reduced overspend for the year just ended, although I think we have to recognise it's still a 1.8 million overspend. My 2 questions relate to section 2.2. Firstly, the unanticipated level of national rebate on the GP prescribing you spoke about, Jane, has that happened in previous years, or is this the first time? And my second question on the reserves, the reduction of 1.3 million in reserves, has that effectively been used to reduce the level of overspend? Thanks.
To answer each question in turn, Ronnie, thank you for that. National rebates are a feature of each financial year. They have been difficult to predict. The level of predictability has, however, improved. And for the financial plan for next year, members will perhaps remember that in our 2021 financial plan, we have actually built in now an anticipated benefit from those rebates based on that greater confidence and longer term planning at national level. In relation to your second question, reserves, earmarked reserves have absolutely not been used in 1920 to support overspend. They've been used absolutely to meet the recurring commitments in line with strategy objectives.
Okay, so that means that the 1.8 million, had the reserve level stayed at the same balance, it would still be 1.8 million if we were carrying forward 2.4.
I'm not sure if I understand the question.
Perhaps, I mean, I'm not wanting to get into too much detail. It might be an offline question, perhaps, but I just wasn't clear in the way that the reserves were being used, whether that was impacting on the financial outturn for last year, and had the reserves, for example, not been used for their specified purposes, would we still have had a 1.8 million outturn overspend?
Sorry, I'm not hearing you yet, Jane.
We can see you.
No, sorry. That's not good. Are we able to fix this, guys?
Difficult to do, Councillor, because it's not a PKC device. It's difficult for us to support that device, Councillor Drysdale.
Okay, so I'm afraid at the moment, Jane, we can't hear you, which is unfortunate, since how it's your report we're listening to. I just wonder if we'll give it a few minutes to see if that can be resolved. Jane is going to dial back in. If I may, just while she's away, in an effort to push on with the agenda, I wonder, Gordon, if you could quickly just give your action point update. Sorry to dump it on you straight away like that, but I just wanted to try and get a quick discussion.
Okay, let me find that in my papers. I was reading the finance papers.
No, hang on, she's back. She's back. You hear us now, Jane?
Can you hear me?
We can hear you.
Excellent. Apologies. To just answer Ronnie's final question, if we hadn't committed our reserves in 1920, they would have been carried forward again into 2021.
Okay.
And therefore they could not have been used to supplement or support the 1920 position.
So the reduction in the value of the reserves between the 2 years represents amounts spent, is that correct?
Exactly.
Yeah, but they were spent in 1920.
Yes.
Yeah. Again, that's just back to the question I asked a minute ago, which I don't think that point answers, which is whether that 1.8 million overspend at the year end included the element of earmarked reserve spend within the accounts for 1920.
The expenditure that has been incurred that ultimately arise at our outturn position includes that expenditure that has been involved in reducing the reserves level.
Okay, so I think perhaps maybe the way I worded the question wasn't quite right in saying that the reserves haven't specifically been used to reduce an overspend, but they have had the effect of reducing the overspend, even if that was not the intention. That is the way I understand what you've said.
That isn't what I'm saying, Ronnie, because we've incurred the expenditure and that's been fully offset by the reserve that was carried forward with no net impact on year-end outturn.
Okay, if there's still a wee bit of lack of understanding, Ronnie, or clarity of answer on Jane's part, I'm not sure, but if we can just ask if you can possibly take that offline and make sure that you're satisfied with your answers, that would be helpful.
Thank you.
So, Councillor Duff.
Thank you, Chair. Hopefully mine is a bit more straightforward and simpler. Jane, the reduction in overspend from our earlier predictions is obviously excellent news, but is any of the remaining £1.8 million overspend to the 31st of March coronavirus related?
No, we have incurred expenditure in relation to COVID-19 in 1920, but those costs, as far as we understand them, have been fully met by additional Scottish Government funding.
Okay, thank you.
Thank you. Okay, Jane, if you want to move on to your budget update.
Thank you, Chair. The IGB approved...
Apologies before you just start. Councillor Madeira's just come in with a last second question.
Sorry, thank you, Chair. I just wanted to, it was mentioned that I'm trying to find the correct, I was trying to find the correct paragraph. 2.5, you mentioned the financial risk sharing agreement. I'm just wondering where we are with that at the moment.
Oh, you're on mute again, Jane, sorry.
If I could defer to my Chief Officer to respond to the progress and discussion of the risk sharing arrangements.
Thank you. So the position is that we still have this same risk sharing agreement that we have had for some time now, where any under or overspends in relation to council funding would be returned, or the council would bear the cost of that. And similarly, in relation to the NHS, we need to potentially consider how this can be reconciled with the arrangements elsewhere in Tayside. And whilst the Chief Executives have given a commitment to consider this, it may well be a matter that we can incorporate into the review and revision of the integration scheme.
Is that a follow-up, Xander?
Yeah, I think on the back of that, at the last meeting we had a decent discussion around the workforce agreement as well. Is that still being discussed as part of this?
So the matter of the joint working agreement is a matter that was to be remitted to the 3 council chief executives with Grant Archibald. Unfortunately, that is not something that has been able to be progressed because of the focus on the other immediate business at hand. So we will have to revisit that at a point in time.
Okay, thank you.
I think that's understandable. Thank you.
Okay, thank you. Okay, Jane, back to you in 2021. Jane, can you hear me?
Sorry, Eric, I just wondered if Karen wanted to come in.
Oh, yeah, so she does. Yes, Karen.
Thank you, Chair. The work on the staff side that we agreed to undertake, I'm still waiting on the comments and the concerns from NHS staff side. At the last IJB meeting, they were going to be forwarded through to me and to my fellow chief execs. So if those could be sent, Chair, that would enable us as we move out of the immediate crisis response for the 4 chief executives to have an informed discussion. Thank you.
Well, that would be very helpful, and thank you for that. Okay, okay, moving on to the 2021, and keen to make progress now and move forward. Thank you.
Thank you, Chair. The IGB approved an interim budget for 2021 at its meeting in March. A balanced position was presented for social care following a very positive settlement from Perth and Kinross Council. A gap of £1.8 million remains in health services for 2021 to be balanced over the 3-year period of the plan. Discussions have been ongoing with NHS Tayside, but we've not been able to agree bridging funding. In parallel, however, we have looked at all other opportunities to bring the 2021 position closer to balance. Importantly, £0.6 million of the £1.8 million gap in health services relates to inpatient mental health services. And as part of the improvement and strategic discussions that we've just talked about, financial sustainability, and particularly in relation to the recommendations around locum costs, needs to be a cornerstone. And I have been in discussion with Kate around ensuring strong senior finance leadership at the right appropriate point on that group. We're also planning for some benefit from year-on-year underspend in relation to other hosted services in Tayside. That predominantly relates to psychology services hosted by Dundee. So we've built that into our forecast. And we finally built in a level of demand management that we believe that through creative look at health services supporting LD clients across Perth and Kinross, we will be able to make inroads against what is an increasing pressure that ultimately will be responded to by the transfer of monies from inpatient beds in learning disabilities. So we set ourselves a target in that respect. So aside from inpatient mental health services, which is being reported separately now, and that in many ways will support the change to operational governance arrangements. We're reporting a £0.6 million gap in the budget, and will continue to identify all possible other measures to bring that closer to balance. Clearly, the impact of COVID-19 raises a significant number of questions about the assumptions underlying our financial plan, and I will cover that to an extent in the next paper.
Okay, thank you. Do we have any questions on that paper? We have Ronnie Erskine with a question.
Thanks, Eric. Thanks, Jane. I'm just trying to understand where we are actually in some of this. I'm looking at the wording in 2.2, which says specifically, however, NHS Tayside have not been able to fund this arrangement. That reads to me like NHS Tayside is an obstacle here to an agreement. I wonder if Jane could maybe tell us a bit about what recent discussions have taken place and what any of the barriers might be to reaching a resolution in relation to the financial situation between the two bodies. I think as a member of both boards, I find it somewhat frustrating that we're not able to get to a situation that we have sign off on both sides here. And I'm aware there's an open door from the Finance Director at NHS Tayside, so I'm not quite sure what the barriers are to reaching a common consensus on this. Thanks.
Can you hear me okay, Eric?
Yeah, we're fine. Yeah, we can hear you.
I think one of the factors that makes it challenging, well, I suppose the first thing to say is what I would not want to do is in any way kind of undermine what have been, positive discussions with NHS Tayside colleagues. The difficulty we've got is that we have moved on to doing 3-year planning and can set out balance over a 3-year period. That tends to be somewhat slightly out of line with the NHS Tayside approach, and I think that perhaps is a barrier to seeking to agreement to bridging finance, which the move to 3-year planning is not an issue just for NHS Tayside. I'm well aware that boards across Scotland find the focus across a longer term period challenging. I would suggest that that's been one of the issues, that we're working to different timeframes, and that has been a challenge. But I would probably ask Gordon whether there's anything more he wants to say in this respect.
Gordon,
no, I think we've laid out a plan that would seek to achieve balance within 3 years, which is not dissimilar to the approach that NHS boards take nationally with the brokerage that they are often able to receive from the Scottish Government. We had thought that some investment in relation to year 1 would have been worthy of consideration and would have taken us to a position whereby year 3 we would have shifted the balance of resources from some of the current investments in hospital services to community services. But unfortunately, that isn't something that is able to be considered given the year-to-year planning that the NHS are looking at financially.
Can I ask follow up on that, Eric, please?
Of course.
I'm saying the wording in the paper is fairly stark around not being able to fund this arrangement. I'm not sure if that means, given the 3-year and the 1-year scenarios, that we need to look at an alternative plan for the IJB, which is over 1 year rather than 3 years. We may well be looking at a £600,000 shortfall if we exclude the mental health issues that you talked about earlier. Are there options out there that we could revisit as a board and explore to try and close that gap if for whatever reason we can't reach some agreement with NHS Tayside? Thanks.
Yes, that's what we would effectively have to do, and that would be about which services can we no longer afford to sustain, what other alternatives could we bring forward in terms of redesign. and been very clear about the pressures that we sometimes experience in relation to increasing capacity when there are pressures in different parts of the system, but inability to provide resources to invest in the community infrastructure.
Thanks, Gordon. I mean, I do appreciate we have a several £million number about to come up in the next paper, which is overwhelming, the 600,000, but I thought it was worth giving it a bit of an airing. So thanks for your and Jane's response.
Okay, thank you. And Councillor Purvis, you have a comment to make.
Yes, thank you, Chair. I just wanted to make a comment on some of the points that Mr. Erskine had made, and just to reiterate my view. I think I've expressed at the board before of how important it is that we managed to get to the stage of doing 3-year financial plans, and I think the Chief Financial Officer and others should be commended for the fact that we've been able to achieve that on the council side. I think that's really important, particularly with some of the transformation projects that we're trying to do, the enhanced community support and other things, that you need that longer timescale to be able to demonstrate the investment in year one is going to deliver savings in future years. So I would be very reluctant for us to consider, I'm not sure, perhaps I misunderstood what was said, but I'd be very reluctant for us to go down the line of looking at a 1-year financial plan simply because NHS Tayside are not willing to cooperate. I think, you know, at the moment, yes, it is, we are being more critical of NHS Tayside than perhaps Perth and Kinross Council, but it hasn't always been the case. Sometimes the council have been less cooperative on things in the past, and sometimes it's been NHS Tayside. So I think the point is this is an issue at the moment that the council seem to be working collaboratively with officers to try and work up those spend to save and other proposals on the social care side. And I think that the issue seems to be that we haven't quite got to that stage of full collaboration on the health side. But I would really be reluctant for us to go down the route of returning to 1-year budgeting. I think that would be poor financial planning.
That's noted, and thank you for that. And I think finally, oh no, there's two finalies. First of all, I've got Maureen wanting to come in with a comment at this point. Maureen.
Hello.
Hi, Maureen.
Hello. Oh, you can hear me. Yeah, the question and I'm really concerned about this, is that Action 15 money, which is ring-fenced for mental health, stood at 171,000. And I see, according to the charts, that it might not be on this paper you're talking to, but I have to vacate this building very shortly. I'm at the PCAF Centre, so I just want to get this in. There was 152,000 transferred out of that fund, leaving the balance at 19,000. Now, what you're saying now, I think, or what I understood from comments earlier, was that 19,000 will also go, leaving nothing in the Action 15 money, which was actually ring-fenced specifically for mental health. It was untouchable, so we've been told for the last year. So I'm really annoyed at this, you know. And also the comment in the Courier that I was referring to earlier said that you know, the use of reserves mirrored what was being done, you know, with other public bodies, and any national agreement to suspend nationally driven modernisation programmes. Well, I would say that this is not a modernisation programme. This is life and death for people in the community. This money should be used in the community. I know of 2 suicides just since the lockdown started, and it's just disgraceful that we would even contemplate using this money.
Okay.
I had an email. Yeah, I had an email from a lady who was trying to set up a crisis house in Perth, and I said I would ask about, you know, Action 15 money to help her to do this. This is a much needed service, and thank goodness somebody is going to do it. So I would like to get back to her and let her know what the position is.
Okay, I'm sure Jane and Gordon will be able to give you some comfort in that regard.
If I could reiterate, Maureen, and provide absolute assurance that Action 15 funding in Perth and Kinross has been fully ring-fenced to invest in community mental health services. The vast majority has been spent now, and what you see is a remaining balance of £19,000. That's all that's left, having spent the large balance on investment in those services. We've only got that small balance left. It's fully committed, and as a partnership, we're fully committed to ensuring that, plus additional spend in our mobilisation plan, will further enhance community mental health services in Perth and Kinross. Gordon, do you want to come in?
No, absolutely. I agree exactly with what Jane said. We have spent far in excess of that £19,000. However, that £19,000 is committed. Action 15 money is ring-fenced, and we would not wish to do anything to compromise that. We would, I think I said earlier, the commitment that we have to developing community mental health services is very clear, and we will be increasing the level of expenditure on the third sector and on services that support people in Perth and Kinross with mental health issues.
Okay, thank you for that, and I hope Maureen, that has given you the level of assurance you require, and that you don't get locked in.
I wonder what to say if I get back to this girl and ask, who's probably going to ask me about available funding.
Eric, could I come in?
Yes, of course.
I think that's a project that we're familiar with, and I've asked one of my managers to meet with them in order to discuss how we can provide support, either financial support or any other support in terms of referrals, advice, information, signposting. So if that's the same service, I think we're connected in with it, Maureen, but it would be useful if we could discuss this offline, and I'm happy to provide any reassurance I can.
Can you give me a number I can contact you on then, please?
Yeah, I'll get somebody to arrange that.
Email it to me, yes. Okay.
Yeah, okay.
Thank you. I'm probably going to have to go now because the building's got to be emptied, so thank you.
Thank you. Councillor McDade, you have a comment?
Yeah, thank you, Chair. It was just to follow up on Councillor Purves' comment and Mr Erskine's remarks earlier. I do think that we made an awful lot of effort at the earlier stages of the IGB to move to 3-year budgeting, and it's been a big success as far as I'm concerned out of the IGB, and Mrs Smith's work on that has been huge. So I think it would be a significant regression to go back to 1-year budgeting, and I think if we need to support NHS Tayside to get to a 3-year budgeting position, that would be better for everyone in terms of financial planning for them and for us. But I think it's quite important that we do stick with 3-year budgeting, and I would be very against regressing back from that.
Thank you, and I would endorse your views, and both on no U-turns from 3-year budgeting, and to commend Jane for her work in developing that over a lengthy period. So thank you for that. I've got a final comment from Ronnie Erskine.
Just following really on the last couple of comments and yours, Eric, absolutely 3-year budgeting in principle. I have no issues with that. The issue here for 2021 is a financial deficit. So a 3-year budget in principle is fine. Thanks.
Okay, no, thank you for that. Yep, okay, so thank you. And finally then, Jane, if you would like to move on to your COVID costs.
Thank you, Chair. I'll be as quick as possible, very conscious of the time.
So late to finish by 5 o'clock.
Oh, sorry, and the sun is shining so brightly and everybody's desperate to go. However, Gordon has already outlined the significant and dramatic changes to our day-to-day services that have been required. The shape and scale of our services still continues to change almost on a daily basis. And therefore, the estimates set out in today's paper are just that. They are very broad estimates based on an ever-changing picture of service delivery. The key areas in where we will see significant change moving forward in particular, we have just submitted to Scottish Government our Phase 2 recovery mobilisation plan, and within that, further changes with further financial implications will require to be now reflected through a further iteration of financial forecasts. We continue to respond closely to Scottish Government guidance in relation to their requirements for service delivery and support. Care home support is a particular example of that, and therefore our costs are changing in relation to Scottish Government guidance. Finally, the other key area where we will learn an awful lot around our costs will be when we have the first quarter of actual expenditure, and that's going to be particularly important in relation to workforce costs. We have, as Gordon has indicated earlier, responded very agilely with the establishment of a workforce matching unit to move staff around to make sure critical services could operate over the core period, and have hopefully in that respect managed to offset what could have been significant additional costs. However, until we have the first 3 months of actual expenditure, it'll be very difficult to understand what that's looking like. At this stage, the assumption is that net additional costs will be funded by the Scottish Government, and we're in close dialogue week on week with Scottish Government colleagues to provide the necessary assurance for funding to be allocated. We will have to, after the first quarter, undertake a full review of our planning assumptions, financial planning assumptions, in parallel to our strategic planning assumptions, and recalibrate our financial plan. And as part of that, as we move on to stage 3, our renewal plan, we will need to build in the financial implications of that into our financial position moving forward. However, as Gordon says, there is the opportunity to embrace many of the changes that have been accelerated over the last 8 weeks to positively accelerate service redesign to support financial sustainability. Happy to take questions, although I have to say the level of speculation and estimation in the cost at this stage would make it very difficult for me to answer any detailed questions in that regard.
That's understood. Okay, are there any questions at this point? No, I don't think there's any questions coming up. So thank you, Jane, for your reports, your collective 3 reports, and can I ask the board, by exception, to if they wish any further comments, but otherwise can we agree to note the reports? Thank you, thank you. Some sort of nod of the head was seen. That'll do fine. Right, thank you. Now, moving on, we have the remainder of the agenda to cover. As regards, first of all, if I may, regards items 6 and 7, if I can just clear these. First of all, the intention now is that obviously, as has been explained by Gordon during his presentation earlier, the focus naturally has been on COVID and the mental health angles, and he has to some extent covered the agenda that we are trying to pursue during 2020. If any member has any particular point that they wish to raise, please can they do so now? Otherwise, we'll ask Gordon to provide a more detailed update on this at the next meeting. Okay, thank you for that. We will do just that. Now, if I can just try and bring together, therefore, items 5 and 8 and 9 indeed into our final discussion. First of all, with regard to the minutes of the meetings of the 12th of February, I'm just reading a comment from Callum there. Okay, I understand Xander has a comment to make on the minutes when he comes back in. He's had to drop off. So what I was going to say in relation to these minutes of the 12th of February, the 31st of March and the 21st of April to so I'm getting other comments in here, which we'll come to. Slightly distracted, apologies. What I want to say is I want to clarify my previous public comments, which were inaccurate, and for the record state that there is no dubiety that councillors McDade and Purvis dissented at the decision of the board to approve the 2021 budget in the special meeting of 31st March, which was conducted in writing by email, given the emergency and the level of emergency at that time. I have noted their dissent at that and have asked and will, sorry, I beg your pardon, will ask the external auditors of the Integration Joint Board to review what happened and comment on that, as in the interest of openness and transparency. I don't want there to be any lingering feelings that that things were done inappropriately. So I have and will ask the external auditors to comment on that as soon as possible. With that having been said, and acknowledging that I'm not sure if Xander's back in yet or not, I note the comments that have been made in the meeting chat. Sandy Watts is saying that she was present at the meeting on the 12th of February but not listed in attendance. I wonder if that can be checked, Clark, and rectified as appropriate. That would be helpful. But that having been said, can I otherwise ask if we are okay to approve the minutes of the 12th of March, sorry, the 12th of February meeting, first of all? If anybody's otherwise minded, please comment now.
Happy to propose or second.
Thank you, and that's seconded by Mr. Benson. The meeting of 31st March, the minute thereof, do we have a proposer?
Pat Kilpatrick.
Pat Kilpatrick proposes. Do we have a seconder?
Happy to.
Sorry, who was that?
Ronnie.
Ronnie, hi, Ronnie, sorry. Okay, Councillor McDade, I see you have reappeared. I understand you had a comment. I don't know if you heard what I was saying there while I was away, but do you have a comment to make?
Hi, sorry, Eric. No, the Surface Pro died, and then I couldn't get back in for some reason. Whereabouts are we on the agenda?
Right. Okay. So. Right, so we've quickly covered the action point update and matters arising. I don't know if you heard that. We're basically asking, given the circumstances, for Gordon to come back with more of a report on anything that's outstanding at the next meeting, and everybody has agreed to that. And so what we're now doing is items 5, 8 and 9 kind of together. And what I've said on the meetings of the minutes of the meetings, which we now have approval for the 12th and the 31st of March, 12th of February and the 31st of March. My comments that came before asking for approval was that I wish to clarify my previous public comments and correct my comments and say that both yourself and Councillor Purvis did dissent at the decision of the board to conduct the special meeting of the board on 31st March, effectively in writing and by email, in order to approve the budget for 2021. That is agreed, and there is no dubiety about that. And what I have said is that we are asking the external auditors to review what happened there and to comment on whether they are satisfied that that the governance around the minutes of that meeting in particular are appropriate, and so we'll report back on that further at the next meeting. And so that's where we've got to, and I was about to then move to the meeting of the 21st of April and ask for a proposer and a seconder for that minute. Do we have a proposer?
Sorry, Eric, before we move it, I have a point on 5.3 in terms of accuracy.
That's the 21st April meeting, yep. Okay.
Yeah. The minute, as far as I can see, reflects your second motion, which I supported and Councillor Purvis supported in addition to a number of other members of the board, but it doesn't reflect the original motion that you made on the 14th of April for that meeting, which was also discussed effectively by the board about and was publicised online as well about postponing meetings. So whilst I supported the second resolution, I didn't support the first one, and I think the minutes should reflect that there were two resolutions and the board had a discussion on two resolutions, and we did resolve on the second one, and a number of board members resolved on the first one as well, but obviously I was not one of those board members.
Okay, Scott, you've appeared on screen. Does that mean you wish to comment on that?
I was ready and willing to comment if necessary, but yeah, I'm happy to revise the minute in accordance with Councillor McDade's suggestions, and we can bring it back to the next board to check that members are happy with that. Okay, so we'll leave that one to be amended and brought back at the next board meeting. That's fine, thank you. Okay. Okay, so the issue of item 8 and governance and standing orders, again, between Scott and myself, we wish to put together, we've had an informal discussion on the governance side of things, but perhaps before we come to that, Scott, do you want to go through the items that you need to formally record in terms of the email that you sent to me the other day, and just, do you want to go through that? Yes, Chair, just briefly. In terms of the Audit and Performance Committee of the IGB, I think it's appropriate that the board make a formal decision today regarding continuation of meetings of the committee. So my understanding is there's been discussions between yourself and Councillor Purvis as the chair of the committee, the chief officer and chief finance officer, that these meetings should continue, and that the next meeting is scheduled at the moment for the 22nd of June. So I think the board needs to just agree that that is the position, and in terms of membership of the committee, the board are asked to agree that Ronnie Erskine be appointed as an additional voting member of the committee. One other thing on membership is to note that Dr. Dougie Loudon is stepping down as a non-voting member of the board, and we're asked to agree that Dr. Lee Robertson, Associate Medical Director at NHS Tayside, is the replacement as a non-voting member. I think that's all on membership.
Okay. Okay, so on that second point first, can I just place on record my thanks to Dougie Loudon, not just for his contribution to the integration joint board during his time involved, but also for his leadership and front-end responsibilities in Ward 42 at Ninewells, which was at the start of the outbreak, the Centre for Referrals for COVID-infected persons. So thank you to Dougie for his leadership in that area, which was quite remarkable. As regards the Audit and Performance Committee, Councillor Purvis, are you comfortable with with the proposals?
Yes, we've already had a preliminary discussion with the Chief Financial Officer about what might be on the agenda for that meeting, and my view would be that it would be very important for us to continue with that if the board are willing to agree.
Okay, if there's anybody otherwise minded, can they please shout now? Otherwise, I take that as read. Thank you. And can we also agree to the appointment of Ronnie Erskine to the Audit and Performance Committee? Okay, I take that. Thank you. Okay. Right. As regards the long outstanding issue of standing orders and review of standing orders and the various aspects thereof, you know, we have just undergone a 3.5-hour meeting on 2 or 3 of the most important items that we'll ever have discussed. But I'm always conscious that the whole discussion of governance and of the Integration Joint Board is getting pushed back with every meeting. We do have extremely important business to discuss, and we will continue to have that over the summer, that I'm sure. So what I wanted to propose was that we form a short life member officer working group to examine the issues that have been discussed around this table, this virtual table, over many months, and to come back with hopefully joint recommendations as to the way forward to improve the standing orders of the Integration Joint Board. And I wondered if, and apologies we haven't managed to speak, Xander, I wonder if you would wish to become involved in that member officer working group, which I was kind of hoping would be one from the PKC members, one from the NHS members, plus the clerk, plus Scott, and any other non-voting members who would care to be involved. I don't think there's terribly many left on the call, but Xander, would you be content to be involved in a short life working group?
Hi, Eric. Yeah, I mean, I'm very happy to be involved in any group in terms of reviewing the standing orders. As we all know, I do enjoy a good set of standing orders. I do actually have a question for Scott separately, but once this part of the discussion is finished.
Okay. Karen Reid, do you have a comment to make?
Yes, I do, Chair. Thank you. And it's very good to hear that there will be progress with governance and the standing orders. Can I make sure that in addition to the clerk to the committee, that proper legal advice is provided too in terms of the legal advisors to the committee? Thank you.
Of course. Thank you. Thank you. I also see Sandra. God loves a volunteer. You wish to volunteer to be part of that?
Yes, very happy to help.
Thank you for that. That would be really good. And I wish to propose Ronnie Erskine again to be part of the group. Ronnie, are you content to accept that nomination?
Yes, I'd be delighted. Yes, perhaps you're going to cover this, Eric, anyway. But I note the item is headed governance and standing orders. Is the intention to look at broader governance issues as well as the standing orders document?
I think what I would quite like to do is to give you a blank sheet, not a blank sheet of canvas, but I want you, yes, absolutely, to come back and with preferably joint recommendations, which, as Karen Reid has said, has passed an initial legal test, come back with some joint recommendations, ideally at the September meeting, if that can be achieved. I appreciate it's quite difficult. We're 3 or 4 months between now and that meeting, but I think that gives time for discussions, albeit virtual discussions, to try and come up with a joint plan of action, because frankly, we need to. The standing orders are an evolving document, a living document, but we need to have confidence in what in the framework that we're operating under. And so I would be very happy to give a broad remit to this working group, if that's okay with the board. Is there anybody otherwise minded?
Would that effectively be terms of reference or an outline of what might be expected for outcomes? What might be an idea, coming on in a moment to talk about future IJB meeting dates. I wonder if between now and over the next couple of weeks and ahead of the next IJB meeting, if our proposed terms of reference could at least be drawn up and the board can endorse that and leave you to go away and work on that for the following weeks. I see Councillor Purvis is looking for a comment.
Yes, thank you, Chair. I just wanted to say this has been something that has been discussed for a long time, both in terms of the revisions that are required to standing orders, but also general governance arrangements for the Integration Joint Board, perhaps also taking into account any changes that might need to take place in relation to the integration scheme. I'm not particularly happy, given that this is something that we've been supposed to be having a discussion for all board members that want to participate for some time, that it seems that without any consultation you've pre-selected a membership for a short life working group, and my preference would be that any members that want to be involved in that are allowed to be involved in it, rather than some arbitrary set membership, including people who aren't perhaps interested in these particular matters, particularly given the fact that this is something that has been needed to take place for some time and that hasn't happened.
Yeah, I take your feedback on that. My view was and is that yourself, Callum, you are currently chair of the budget review group and audit and performance committee, and I was anxious that we try to pick the people who have possibly, other than yourself, who have expressed the most interest in the subject matter and the most enthusiasm for getting these things right, which was why I had approached Ronnie in advance. I hadn't approached Sandra in advance, just the way the conversations have panned out over the last couple of days. But I still believe that that the individuals who have so far agreed to become involved, and thanks Sandra for also coming forward, that these people would be able to drive it forward. But if there is anybody else that wishes to become involved in this discussion, then I would be happy with that. But we do need to try and ensure that there is a balance to it as well. And for that reason, I'm particularly glad that a public partner has agreed to volunteer as well. Callum, you want to come back?
I think it's just to make the point that this was supposed to be a discussion that involved everyone who wanted to participate in that discussion. There have been points that I've wanted to make on a number of occasions, but it's always been towards the end of the agenda. While appreciating that all of the items on most of these meetings are extremely important, I think it is important that everyone who wants to be involved can be involved, because that was what was the original stated position.
Yeah, well, I mean, absolutely, and everybody will be involved as part of the. This is not Indy coming back with, this is what the new standing orders are. This is them coming back with with worked up proposals. But I see Karen Reid looking to comment. So Karen, can you come in here?
Thank you, Chair. Chair, just as a way of trying to reach a positive solution on this, I wonder whether you may consider, as in support of the Member Officer Working Group, to bring forward proposals that there is a development session with the IJB in its entirety to capture all the comments and thoughts that everyone has around this, and then the Member Officer Working Group could go away, work those up and bring it back. It's just a suggestion for you to consider, Chair.
Thank you. I appreciate that comment. And Councillor McDade, do you have a comment?
Yeah, thanks, Chair. I mean, I think Councillor Purves makes a valid point in terms of that this is obviously some of us have been raising governance issues for a long time, and I think that one of the successes I felt of the more recent years of the Budget Review Group, where when it was extended out to open up to all voting members to attend. So I think it would be, quite positive in terms of getting a consensus agreement on future governance arrangements if we could perhaps have that open door of any voting member who wishes to attend may attend, but there's not an expectation that everyone will attend, and that allows those who do want to be involved, and those who don't wish to get heavily involved in the detail not to be involved. And I think that would allow us to reach a consensus position both before and then at the board, which would be helpful in this particular area.
Okay, no, that's helpful, and thank you for that. And Ronnie Erskine, you have a comment as well.
Thank you, Eric. It's obviously much easier to thrash this out round the table than to do it remotely, I think. But what I think is particularly important here, whether we have a development session or not, which is a good thought, is that anyone that wants to be involved in the creation of the terms of reference, who has burning issues that would like to be covered, that we get these emailed in before the terms of reference are agreed. And likewise, as part of the process, I think that all stakeholders, not just IJB members, because we have voting members, non-voting members, we also have others who attend our meetings who are not part of the board. I think it's important that we engage in the views of all stakeholders in terms of trying to find the right solution. I have to say I would not support a free-for-all in attendance, because the importance is that we get attempt to try and come up with a balanced view which can then be submitted for discussion. It's not a fait accompli. That's the way you explained it to me. It was to try and coalesce around some form of consensus that might take us closer to something that can be agreed by everyone in a meeting, rather than have 8 people around the table try to do that. So it's trying to find the shortcut way of doing this. I tend to find committees of 6 or 8 don't work. It's easier to bash something together in smaller groups, but I appreciate there are other views. Thanks.
Sure. And Xander.
Yeah, I appreciate what Mr. Erskine has just outlined. I think the point, though, is that part of the issue has been lack of consensus in the past, and that it would be very unhelpful to end up at a situation where we might manage to agree a set of standing orders that don't have the consent of everyone sitting around the table. I think we've had a lot of governance issues that we've raised over a period of time, and some of us have been more vocal than others around those. I think it would be unfortunate if we can't allow those who wish to be involved in this discussion to be involved in this discussion. I'm quite well aware that most people do not get excited about this subject, but for those of us who do have a very strong interest in this subject and do perhaps have a more archaic knowledge of this particular subject, it might be appropriate to allow the group to be extended to at least, Councillor Purvis obviously has a lot of involvement in this subject in other areas as well. It might be appropriate to allow 2 and 2 perhaps. That isn't then opening it up to a free-for-all, but I do think that we need some consensus around this subject, or we won't actually achieve a consensus at the end.
Well, indeed, the motivation here is to get something done. I'm happy to be guided by the board in terms of how best to get this done. What I don't want, it's too important a subject to be a tail end Charlie at the end of a long afternoon, and it needs to be taken offline and worked on very carefully. How we go about that, I'm open to persuasion, and Mr. Benson has a question, I see.
It's not a question as such, Chair. It's really just, I think, to support your general direction of travel that you were setting out initially, is that you wanted this to be a short life working group that would come back relatively quickly by September with some outline of proposals, and that outline of proposals would be based upon the views of the group. Now, clearly there will be the opportunity, as Ronnie has suggested, is that there is email correspondence that takes place that could include the whole board, and I think we're not just talking about voting members here, that would enable us to at least get some richness into the considerations that Sander and Ronnie and the clerk and legal would bring together on this. Otherwise, we will end up with an enormous debate beforehand, and I think we may have problems with your aspiration to have proposals that would be put forward by September. So I have some concerns about this. I also think that Karen's suggestion of having a development session on it is very welcome, and we could do that at various stages when there are a range of options that might arise as part of the deliberations that Ronnie and others have come to. So I really think we need to move on with this rather than having a whole group of people working on this immediately. I'm quite content with the original composition that you'd envisaged.
Thank you, and Councillor Purvis, final comment.
Well, no, thank you. I'm sorry, but I think this is something of a nonsense. My approach has always been one of inclusivity as chairing the Budget Review Group, which is effectively a member officer working group, and all board members with votes have been entitled to attend. There's no obligation for them to attend, but they can attend should they wish to do so. And we made every effort to ensure that all non-voting members and other members were engaged in that process. So my view is that it should be open to all members, and I really don't see any reason why that should not be the case with this. I think it's worked well in the past, and the issue is at the end of the day, often these things, whether it's a short life working group or the budget, the expectation is that whatever is produced will be agreed in full at the end, and that certainly can't be guaranteed if this is the approach that we take.
Okay. Can I ask, I hear everybody's views, and there's merit in them all, clearly. What I would like to do to conclude this debate just now is to suggest that the 4 individuals who have agreed to become part of this working group go away, arrange an initial high-level discussion, which is purely to set a timetable to continue this debate, if you like, and to reach a consensus view on the best way to achieve results, because we all want results. We all want this issue, this perennial issue of standing orders to be resolved and for everybody to be happy with it. And I fully accept that that's not going to happen if Councillor Purvis feels aggrieved about the process. So can I ask that the 4 members of the group reflect on Councillor Purvis's comments in particular, and take them on board, and between now and the next, the next meeting of the board, come up with their proposals for how best to take this forward. Not to have any substantive discussions initially on the standing orders, but to come up with a recommendation to the full board at its next meeting as to how best to handle this. Okay, thank you. Right.
Sorry,
okay.
Eric, could I just seek a point of clarification? When you talk about 4 members, are you talking about 2 members appointed by Perth and Kinross Council?
No. I'm talking about you, Ronnie, Xander, Sandra, and Scott Hendry.
Ah, right. I thought you meant 2 and 2, and I wasn't quite clear.
I'm very keen that there is complete balance in the thing. I also want to find a way to satisfy Callum's concerns, and I guess that's what I'm asking that group of 4 to do. The 4 people I'm looking at on screen now, to go away and come back with a very high level initial steer as to how you see this discussion taken forward, rather than, this is a verbal report I've given today. I want you guys to come back with something in writing ahead of the next meeting that people can reflect on, pass their comments, and either agree or otherwise at the next meeting, which is the other item on the agenda that we're still to resolve. So unless there's anybody otherwise minded, we'll proceed on that basis.
Was it just one last simple point of administration? Will Scott send out some form of something to initiate this conversation then with the 4 of us?
Chair, I'm happy to do that and initiate the discussion.
Okay, thank you. Okay, thank you for that. And moving on therefore to future IJB meeting dates, item 9 on the agenda. The full council, Perth and Kinross Council, now meets on the 24th of June, which is our next date for a meeting. So I'm afraid we're going to have to move our meeting from the 24th of June. So can I also therefore ask the clerk to seek to arrange the next meeting of the Integration Joint Board as close to that date as possible? Not before it. I think that's only 3.5 weeks, 4 weeks away. But certainly the end of June, beginning of July, to seek to find a date that suits the majority, if not all, members. Councillor McDade, you have a comment.
Hi, thank you, Chair. Yes, I've raised several times that I think we need to have more meetings, because we are always in a situation where we are rushing through heavy agendas with significantly important items. For most of the afternoon we've had to rush through items, and I think actually we need to have more meetings scheduled across the whole year, not just this year but every year. The number we have currently just clearly is not adequate for the level of business that we would expect the IJB to do, and as you've outlined already earlier in today's discussion, items are regularly falling off the end of the agenda essentially. So we need to have more meetings, and I would ask that we remit the clerk to go away and prepare a list of new dates for the remainder of this year.
So this is and I see Ronnie looking to come in again, but this is a conversation that I have had with the clerk already, in terms of and indeed with a couple of individual members that I have spoken to, and absolutely completely agree with you, Xander. It's I find it really frustrating that I really want to have a thorough debate on the items that we're discussing here. I really do. I also want to have, in normal times when we're meeting in the flesh, so to speak, to have the opportunity for dialogue amongst us all over coffee, over lunch, whatever. Perhaps we need to look to go back to the future and potentially have meetings that are on different sites, Perth Royal Infirmary, for example, or a care home somewhere. I don't know. All these things are possible in normal times, and in so doing, improve the harmony of all of the members of the Integration Joint Board, and at the same time allow for extended discussion of the important items. So, for example, we could have all-day meetings, or 10 till 4 or whatever it is, with break for coffee, break for lunch, break for afternoon tea, whatever. Or alternatively have a visit to, like we've had a visit to the prison before, that kind of thing, or Broxton Dental Centre, or whatever it is. We need to very much look at that, and I would invite the member officer working group to examine that aspect fully as well as part of their remit. And now we have, yes, we have Karen Reid, the comment.
Thank you, Chair. It's just exactly the point I was going to suggest, is that the member officer working group looks at this. However, Bob Benson makes an important point in the chat. It's going to be a long time before we have a vaccine in place that allows us to work differently in the context of COVID. So I know that all of you will support staff being deployed to make sure that we are protecting the most vulnerable in our community first and foremost. So we need to strike the right balance in the number of meetings and indeed the length of the meetings. And your suggestion, Chair, to have longer meetings with more breaks built in is very helpful. Thank you. I think it'll be some time before you're able to hold meetings in different venues.
Yeah. Yes, indeed. Okay, and Councillor McDade, you had another comment?
Yeah, thanks, Chair. I think I just wanted to, I understand absolutely where the Chief Executive of the Council is coming from in terms of we do need to be cognisant of officers' priorities in terms of COVID. I do think it's important that governance boards and committees are meeting and discussing this, and that the public is able to watch them. And actually the point I was really wanting to come back to was that at some point in the future, if we are going around and about places, then we still need to be able to maintain the level of openness and transparency that we currently have in terms of the recording of meetings, and ideally live streaming them in the future as well, as we are doing today. I think that is a huge step forward, and as the advocate for putting the IGB meetings online in the first place, I would be very strongly against any move that meant that we could not do that in the future.
All valid points. And Ronnie Erskine, finally.
Thanks, Eric. Just a couple of thoughts. One is this initial exchange of ideas with the group of 4, I would suggest could perhaps come up with something in the short term, given that Xander and I would be involved in this and we both have an eye to the governance side of it, whilst taking into account Bob and Karen's comments, that we might be able to come up with some suggestion in relation to board meetings that might balance the two sides. The second thought, I know one close to your heart, I'm trying to extend the meeting to 7 o'clock now, but the sun is not shining here. Yes, it is. Around the public accountability side of things, which we'll no doubt cover, I have also been conscious that some of our finance discussions are taking place in a forum that is not accessible to the public. So I think trying to get that balance right between what we quite sensibly talk about in private and what we then talk about in a public forum is really important. So that's part of the governance review for me, is about how all of the groups and committees and IGBs discharge that function of public accountability.
Indeed, indeed. Okay, I think we have a consensus way forward. So thank you for that debate, and we'll leave Scott to take steps to organise the initial discussion, and we can continue this perhaps at the start of the next meeting of the IJB, whenever that might be. And obviously, as I say, Scott, if you can also take steps to try and organise that meeting at a suitable date within the next few weeks. Thank you. Okay, we got there, and it's already 4 minutes to 6. So thank you all very much for your time this afternoon, and I appreciate everyone's contributions, and I hope that we can have. I hope that our virtual meetings can soon be replaced by being back together again, but obviously we'll just have to wait and see in that regard. So thank you all for your time this afternoon.
Thank you. Cheers.